program studi Anti-Aging and Aesthetic Medicine Universitas Pajajaran. Di sini kami tidak hanya belajar tentang estetik atau kecantikan, tapi kami juga belajar bagaimana caranya agar bisa menua dengan sehat dan produktif. Karena pada hakikatnya menua itu pasti, tapi penuaan itu bisa dicegah dan dikendalikan sejak dini.
Kota Bandung terletak di Provinsi Jawa Barat. Inilah gedung kuliah kita Pusat Akademik, Inovasi, Teknologi, dan Riset Kesehatan Universitas Pajajaran atau Pamitran UP.
Kesehatan yang lengkap dan laboratorium untuk penelitian yang sangat memadai.
Ini ruang kuliah kita. Kalau kita sedang kuliah luring, biasanya juga dipakai untuk ruang diskusi. Ada tempat fitnessnya juga loh, dan ini perpustakaannya cukup lengkap untuk bahan belajar dan penelitian. Ini beberapa laboratorium yang ada di Pamitran dan dapat digunakan dalam menunjang pembelajaran seperti lab kultur, molekuler genetika, farmako, dan mikrobiologi. Sementara lab lainnya ada di Unpad Jatinangor.
Sistem belajar di kita ada dua macam, ada luring sama daring. Kalau misalnya daring ada sinkronus sama asinkronus. Kalau asinkronus kita bisa belajar dari live 4, jadi kita bisa belajar di mana aja dan kapan aja.
Ini kuliah asinkronus dari Live Unpad. Di sini kita buka video atau bahan kuliah yang dosennya kasih untuk belajar dan waktunya bisa kapan aja.
Assalamualaikum warahmatullahi wabarakatuh. Perkenalkan, nama saya Najman Islami.
Halo, saya Dr. Raymond pada wajah kerja kesetrian.
Dan saya Dr. Asih Budi Utami MKes ITM.
Saya Dr. Mutiara Nabila Yusuf, Magister Kesehatan Anti-Aging and Aesthetic Medicine. Saya merupakan alumni Prodi A3M FK Unpad yang pertama, yaitu pada tahun 2016.
Saya merupakan alumni dari A3M FK Unpad tahun 2019.
Di sini kita sangat concern terhadap korelasi basic science dan clinical science, yaitu misalnya basic science-nya yang banyak kita pelajari adalah anatomi, histologi, fisiologi, biologi seluler molekuler, fungsi-fungsi sel dan lainnya yang berhubungan dengan clinical science, temuan-temuan yang akan kita dapatkan di lapangan.
Nah, Anti-Aging and Aesthetic Medicine Universitas Pajajaran itu mendalami tentang Rejuvenation Medicine dan Aesthetic Medicine. Kita mempelajari dari seluler sampai aplikatif. Luar biasanya kita dapat ilmu itu yang sangat bermanfaat sekali bagi masyarakat.
Jadi, tunggu apa lagi? Ayo bergabung bersama Prodi A3M FK Unpad.
Karenanya saya sebagai dosen Fakultas Kedokteran Unpad sekarang sangat berterima kasih kepada guru-guru kami di Prodi A3M. Jadi tunggu apa lagi? Ayo bergabung bersama kami di Prodi A3M FK Unpad.
Jangan sungkan dan cari tahu lebih dalam tentang Anti-Aging and Aesthetic Medicine di Unpad.
Segera bergabung bersama kami ya.
Nah, berapa yang join? Makasih ya. 35.
English is my second language. As a vlogger, I deal with social social media a lot, which is actually fun for me, but I will say sometimes it's challenging. For my social media, I
Cuma dikasih data satu
Apa
kalau
sih?
buat plan. Oh, kayak gitu.
Ini mana nih mahasiswa yang lain? Hmm.
Selamat datang di program studi Anti-Aging and Aesthetic Medicine Universitas Pajajaran. Di sini kami tidak hanya belajar tentang estetik atau kecantikan, tapi kami juga belajar bagaimana caranya agar bisa menua dengan sehat dan produktif. Karena pada hakikatnya menua itu pasti, tapi penuaan itu bisa dicegah dan dikendalikan sejak dini.
Kota Bandung terletak di Provinsi Jawa Barat. Inilah gedung kuliah kita Pusat Akademik, Inovasi, Teknologi, dan Riset Kesehatan Universitas Pajajaran atau Pamitran UP.
Selamat datang di Magister Anti-Aging dan Estetik Medicine Fakultas Kedokteran Universitas Pajajaran. Magister Anti-Aging dan Estetik Medicine yang pertama kali mendapatkan akreditasi dari Kemenkes Indonesia.
Untuk dosen di E3N berlatar belakang S2 dan S3 dari dalam maupun luar negeri, dan beberapa spesialis seperti IPD, DV, kedokteran olahraga, bedah plastik, andrologi, dan juga gizi.
Kalau kita kuliah luring, biasanya kita datang ke gedung Pamitran di Jalan Prof. Ekman nomor 38, tepatnya di seberang RSHS. Kita kuliahnya di lantai 4 ya. Biasanya kuliah luringnya hanya 1-2 kali per bulan, tapi bisa juga lebih tergantung dosen masing-masing.
Kita mempunyai ruang kelas
yang nyaman, perpustakaan yang lengkap, dan laboratorium untuk penelitian yang sangat memadai.
Ini ruang kuliah kita. Kalau kita sedang kuliah luring, biasanya juga dipakai untuk ruang diskusi. Ada tempat fitnessnya juga loh, dan ini perpustakaannya cukup lengkap untuk bahan belajar dan penelitian. Ini beberapa laboratorium yang ada di Pamitran dan dapat digunakan dalam menunjang pembelajaran seperti lab kultur, molekuler genetika, farmako, dan mikrobiologi. Sementara lab lainnya ada di Unpad Jatinangor.
Sistem belajar di kita ada dua macam, ada luring sama daring. Kalau misalnya daring ada sinkronus sama asinkronus. Kalau asinkronus kita bisa belajar dari live Unpad, jadi kita bisa belajar di mana aja dan kapan aja.
Ini kuliah asinkronus dari Live Unpad. Di sini kita buka video atau bahan kuliah yang dosennya kasih untuk belajar dan waktunya bisa kapan aja.
Assalamualaikum warahmatullahi wabarakatuh. Perkenalkan, nama saya Najman Islami.
Halo, saya Dr. Raymond Padawadi dari Kesetrian.
Dan saya Dr. Asih Budi Utami MKes ITM.
Saya Dr. Mutiara Nabila Yusuf, Magister Kesehatan Anti-Aging and Aesthetic Medicine. Saya merupakan alumni Prodi A3M FK Unpad yang pertama, yaitu pada tahun 2016.
Saya merupakan alumni dari A3M FK Unpad tahun 2019.
Di sini kita sangat concern terhadap korelasi basic science dan clinical science, yaitu misalnya basic science-nya yang banyak kita pelajari adalah anatomi, histologi, fisiologi, biologi seluler molekuler, fungsi-fungsi sel dan lainnya yang berhubungan dengan clinical science, temuan-temuan yang akan kita dapatkan di lapangan.
Nah, Anti-Aging and Aesthetic Medicine Universitas Pajajaran itu mendalami tentang Rejuvenation medicine dan Aesthetic medicine. Kita mempelajari dari seluler sampai aplikatif. Luar biasanya kita dapat ilmu itu yang sangat bermanfaat sekali bagi masyarakat.
Jadi, tunggu apa lagi? Ayo bergabung bersama Prodi A3M FK Unpad.
Karenanya saya sebagai dosen Fakultas Kedokteran Unpad sekarang sangat berterima kasih kepada guru-guru kami di Prodi A3M. Jadi tunggu apa lagi? Ayo bergabung bersama kami di Prodi A3M FK Unpad.
Jangan sungkan dan cari tahu lebih dalam tentang Anti-Aging and Aesthetic medicine di Unpad.
Segera bergabung bersama kami ya.
Cek.
Selamat siang semuanya. Mohon maaf tidak nyamanan teknis. Apakah dapat mendengar suara saya?
Kedengaran? Ini sudah di sini.
Ya.
Dicek atau enggak?
Oke.
Suaranya
Ya.
jauh, Dok.
Oke, terima kasih untuk yang telah respon. Dan sekali lagi terima kasih untuk yang telah hadir di ruangan Zoom maupun rekan-rekan mahasiswa saat ini dari Prodi S2 Medicine, Profesor berada di kampus yang telah hadir secara tatap muka langsung di ruang kampus kita di Bandung ini. Selamat datang kepada tamu kita hari ini, Dr. Fauzi dan Dr. Manira. Selamat siang, Dok. Sehat, Dok, di sana, Dok?
Ya, Assalamualaikum. Boleh dengar? Assalamualaikum and good afternoon. Can you hear me?
Yeah.
Am I audible?
Thank you for your time to discuss our regenerative medicine to our students. Yeah, at first I want to introduce you our study program. Picture of our campus here in Bandung. Yeah,
So sorry, interrupt you. But basically, I can't hear you clearly. I mean, a bit far, and it's like dragging your voice. I'm not sure if like any attendants could really hear clearly. It's a bit. I mean, your voice is a bit far.
Wait.
How about now? Can you hear us?
Yes, loud and clear.
Okay.
Thanks. Yeah.
Okay, great. So you can use.
Yeah.
Okay. Now you can hear me now?
Yes, loud and clear. Thank you.
Okay. Thank you for your confirmation, Dr. Fauzi. Yeah. Okay. Maybe let me start again. Assalamualaikum warahmatullahi wabarakatuh. Selamat datang untuk semua peserta yang telah hadir, baik secara luring atau tatap muka di kampus kami, seperti gambar yang ditayangkan. Dan juga terima kasih banyak pada peserta yang telah hadir secara online via link Zoom yang telah kami bagikan. Terima kasih kepada Dr. Fauzi dan Dr. Manir. Waktunya yang mana nanti kita akan berdiskusi tentang topik regenerative medicine. Thank you very much, Dr. Fauzi and Dr. Manir, to spare your time to give lecture, especially for our student, and maybe later discuss with our student and also participant outside our maybe from faculty in university. There is some participant from outside Unpad, Dr. Fauzi. So I think there are many people interested with the topic. Hope we can have a wonderful and fruitful discussion this afternoon. Okay, but before we continue to our lecture, please next slide. Okay, so this is the topic today. As we share in the social media, also in the Zoom right now, we have 4 topics today, and all about regenerative medicine and related topics from Prof. Nur Atik, Dr. Fauzi, Dr. Naila, and also Dr. Manira. And we held this online lectures because we want to broaden our collaboration with Universitas Kebangsaan Malaysia. Next slide, please. As actually we have same vision, Dr. Fauzi. I have discussed with you before
So our study program here, as you can read, and also all the participants, we have vision to be center of regenerative medicine and aesthetic medicine. Also, we want to make society more aware about the well-being, and also hopefully our study program can be more acknowledged, can be more known in the global in the future years. And here we can see that CTERM is Center for Tissue Engineering and Regenerative Medicine, Universitas Kebangsaan Malaysia, also have the same vision to become an internationally recognized center of excellence in the clinical translation of tissue engineering and regenerative medicine research. So yeah, with this same point at the vision, especially our site really hope that our collaboration will continue not only between lectures but also in other activity, because in our study program, next slide please. Yeah, maybe I already shared to you, Dr. Fauzi, but maybe it's also information for all the participants that our study program have this curriculum. So in the first semester, there is 7 lectures with the title on the screen, and the second semester we have 5 lectures with the topics, and in the third semester, students should present their future research plan, and in the fourth semester they have to defend their research. So today's online lectures is part of the and molecular of aging lectures that coordinated by Prof. Nur Atik here. So maybe in the future we can have more fruitful discussion, not only in the one topic, but other topics, Dr. Fauzi and Dr. Manira. And beside this material, we also have another activity, of course. Next slide, please. Yeah, this is some research topic that already run in our study program by our students, supported by our lecturers and researchers in our study programs. Yeah, we have activity to promote our research topic in our Instagram. So this is captures from the shared topics in the Instagram. So we try to focus on the research on regenerative medicine and also well-being. And also, of course, as our name, our study program also about the aesthetic and anti-aging research topic. Please continue. Not only sitting in the class and doing research, our study program also has pengabdian pada masyarakat. What is it? Society service. Yeah, this is part of our transformative learning. Maybe Dr. Fauzi and Dr. Manira and also all the participants that our study program not only has lectures or doing research, but also we want to share, we want to give impact to our society by giving social service or campaign related topics that needed by society regarding aging, maybe especially. Next. Yeah, our study program also want our students to have more soft skill. So we try to regularly have soft skill activity by holding a seminar that organized by our students itself. So last year we have these seminars titled Stay Fit and Gorgeous. Almost more than 200 participants join our seminars. It was a very memorable moments maybe for our students and also our study program, because after pandemic, this is our first encounter again to the society that we have this curricula and we have this topic of research and we have very competent lecturers that want to give back to the society. Yeah, okay, maybe this is some introduction from me. as our study program wants to give information to you, Dr. Fauzi, for our next collaboration, and also, of course, for others participants outside our study program. Hope this information can give you good perception about our study program. Thank you very much. I want to continue because we already late several minutes by our first lecturer, Prof. Nur Atik. Time is yours.
Okay. Okay, thank you very much, Dr. Astrid. Thanks for giving opportunity for us to deliver this lecture. But for me, to be honest, it's relatively difficult to do a hybrid. Okay, can you hear me, as participant from the online?
Yes, very clear.
Okay, thank you. So, Dr. Fauzi, can you see me? I think this is the first time for us to see, even though still in online.
Yes, I can't see you clearly because it's small
Okay.
screen at the moment.
Yeah, okay. Next, I would like to introduce myself, to be honest.
Okay.
Dr. Fauzi, if you see my CV, actually, I just finished my studies in Malaysia.
Oh,
So, yeah,
okay.
in More program. Within the year, I just graduated there in
Okay.
UM. But
okay.
unfortunately, we never met each other previously. But so maybe next, because
Yes, inshallah.
yeah, inshallah. Next November, I will go there for my convocations. So I hope we can meet.
Okay. We can plan basically. Yes.
Okay, thank you. Okay, next slide. I would like to deliver this lecture, but I would like to ask for the forum, should I deliver it in English or in Bahasa? So students, class, Bahasa or in English? English, okay, great. How about the English? Okay then. Because I believe that even Dr. Fauzi can speak Bahasa, right? Because when I studied there, many people, of course, we still can communicate each other lah. Okay, for the outline today, we would like to discuss about hallmark of aging, role of stem cell in aging process, and then study of anti-aging using stem cell, between the preclinical and clinical study. And then last but not least, we will discuss about the ethical aspect in the study. Why I try to bring this issue, because most of us thought that when we are talking about aging, we always talk about the skin, right? Or talk about the aesthetic. But actually, when we are talking about the aging, not only skin have the process for the aging. I mean, not only aging process in the skin, on the skin. Most of our organ in our body also get this process, I mean the aging process. So that's why we bring that issue within this afternoon class. Okay, next slide. I don't want to bring this lecture for long. I can finish it within 20 or even less than 20 minutes, so we can discuss it, because I believe as well Dr. Cannot stand for give a lecture and bring his or share his knowledge to us. Okay, just for yes. May I continue? I guess ada yang bocor only. Okay, talking about the hallmark of aging, as we try to recall, at least from this paper, I try to cite it from the Cell 2013. They try to propose 9 hallmark of the aging. I think you already get it from the first lecture, right, within this course. Am I correct? Okay, I don't want to test you within this afternoon, but I will try to repeat it for all of us here. At least 9 hallmarks here start from the hallmark of aging, start from the genomic instability, because we know that if there is a changing or instability of the genome in our body, especially in our nucleus, in our cells, it can promote the aging process itself. And then the second, talking about the telomere attritions or telomere, how to say, it's abrasion. It's as well because we know that the telomere itself is the most, how to say, the most, or maybe we can say the most things that impact our aging. And then the epigenetic alterations, talking about the genetic stability, we cannot avoid about the role, the epigenetic itself. And then loss of proteases. On the previous class, we have discussed about what kind of proteases can impact the process of the aging, and then the deregulated nutrient sensing as well. It impact our aging process, mitochondrial dysfunction, cellular senescence. It's very related with the division process itself. And then this afternoon or within this lecture, we will more further discuss about the stem cell exhaustions, because as I mentioned previously, when you try to remember, when you study the histology in the undergraduate students or bachelor, when we try or join to the histology laboratory, and we observe the tissue under microscope, we always recognize the stem cell layer, right? And then we know that the stem cell layer not only on the specific tissue, for example, the small intestine or gastric. Even when we studied brain or brain itself, there is a stem cell layer there. Even though the ability to develop or renewing the cells have a different from one tissue to each tissue, right? So later on, we will discuss more further about the stem cell exhaustions. And then the last but not least, in the hallmark of aging, regarding this paper, they also propose the altered intracellular communications, because we know that if there was some molecular communications in intracellular that can affect or introduce the aging process. And then if we read further from that paper, all these 9 hallmarks have terms and conditions actually. The first is it should manifest during normal aging. So all these 9 happen in the normal aging. That's the first conditions. And then the second, when we try to prove it in the experimental or in vitro situations, it should, when we try to interfere this hallmark, it can accelerate the aging, and then the opposite or the vice versa. If experimental ameliorations, it will retard the normal aging process. So that's the term and condition for their proposal on that paper. Okay, next slide. Okay, talking about the epigenetic and genetic instabilities, when we try to recall our previous knowledge, at least we know that the major epigenetic itself, it can change. And then when the epigenetic change, what happened to our gene? The first is when it will lose of core histone together with first changing in the histones modifications and chromatin remodeling enzyme, and then loss of heterochromatin, chromatin decondensations in centromere and telomere attritions, and then the last or at the end, it will cause the DNA damage. But I like this figure since you see that this is a paper from the Cell Metabolisms 2017. If you see that, do you know what kind of symbol is it? Okay, great. Johan said yin and yang. So actually, we believe that in all bodies there is always the homeostasis. So that's why they put that. I love these figures. They put this kind of symbol because even when we are talking about the genetic and epigenetics, it kind of the yin and yang or body or even in our gene, they try to be balanced or in the homeostasis conditions, because if it changes, of course, it will tend to otherwise it goes to the aging process or even try to how to say the immortal one, just like a cancer. Okay, next slide. Yeah, now we try to go or move further talking about the stem cell exhaustions in aging. So in the stem cell exhaustions or exhaust kecapean, kelelahan gitu kan, it will decrease or decline tissue regenerative potential, because can you imagine that if the stem cell in our body they tend to be exhaust, of course these situations can happen or these conditions can happen. First, tissue regenerative, it will decrease the functions to regenerate our tissue in our body. That's the first. And then the second, what happened in the hematopoietic in our body. We believe that, or we know that even the half-life or the time of survival of the erythrocyte, for example, it's only 120. It's renewal, right? So within these exhaustions or within these conditions, the hematopoiesis itself will decline or decrease. It will reduce the hematopoiesis, leading to immunosenescence, anemia, or even malignancy. And then functional development in stem cell, including for brain, bone, or even muscle fibers. Again, I would like to emphasize there is a depletion of a stem cell function on that specific tissue. Okay, and then what happened to the cell cycle activity? If the stem cell in our body start to be exhausted due to aging process, it will reduce the cell cycle activity. And then how about the telomere the telomere itself? We already know that, of course, when within this aging process, it make the telomere shorter, right? So it's also related with the stem cell exhaustions in aging. Telomere shortening and then stem cell decline in multiple tissue. Again, within that paper, talking about the stem cell exhaustions, they raise issue about the stem cell quiescence versus excessive proliferation. We can imagine that if the tissue always push to develop or renewing their cells, and then compare with the tissue that try to be quiescent or how to say it, stunning or just diam saja, there must be a difference in terms of the exhaustions, right? And we believe that the excessive proliferations can push the exhaust of the stem cell itself. And then it's related with if we try to see what kind of molecule that involve to that mechanisms, at least they try to show role of the protein INC4A. This is for the inductions of stem cell quiescence, and then the opposite is the insulin-like growth factor 1 for reductions of the quiescence itself. Okay, and then last another protein here, FGF signaling leads to loss of the quiescence. So This is the stem cell exhaustions in aging process. Okay, next slide. Oh, in the Zoom, still okay, right? The figure, okay. Yeah, I try to move here because the figure not so clear in our monitor, sorry. In the stem cell exhaustions further, from this paper, it showed that if there is a stem cell exhaustions, we see that, for example, hematopoietic stem cell, it goes to or it results to the anemia, myelodysplasia, and then if for the exhausted in the MSC or mesenchymal stem cell, it impact to the osteoporosis, even the fracture repair ability will decrease. And then in the satellite cells, the ability of the cell for repair muscle fibers also decrease, and then intestinal epithelial stem cells here, it become the functions of the intestinal getting decreased as well. So previous slide, we're talking about this, right? P16 Inc. 4A. I just want to show that from other paper from the Front Immunology published 2021, I just want to show here this kind of protein or gene have a function for cell cycle arrest. This is in the T cell, not in the stem cell, but actually the functions of this kind of protein, INC4A or P16 INC4A, similar. Okay, next slide. Yeah, now we go to the, after we know the functions or the physiologic of the cells regarding the aging process, and then when the stem cell getting exhausted, so we already know. Okay, so if there is a phenotype or stem cell have that kind of conditions, so later on we think that so what kind of study or research on stem cell in aging related disease? Because we already know the background or the how to say it, the basic knowledge or the fundamental knowledge of the stem cell itself. Sorry, the aging process itself. Now we go to the research on stem cell in aging related disease. Why people doing this kind of study? We know that at least there are some justifications, such as increased life expectancy in global worldwide. So we have to admit this. Nowadays, elderly people getting increased even in our country, I believe as well in Malaysia. And then the phenomenon of aging more prominent. Yeah, due to we have increasing number of the elderly people. Of course, the aging process itself more prominent. And then it addressing the problems become a current research focus. Yeah, because the number of the orang tua, of course, it become our focus lah, help problems there, and also for the study or research. And then we know that the main manifestations of human aging itself, it include there is a degenerations of the structures, functional decline from the tissue and also organ, and then quality of life getting decreased or decline, and then decreased ability to resist disease. I think this week, right, we discussed about the effect of the vaccines in elderly people, right? So you can imagine or try to correlate with this kind of situations. And then the last is high incidence rates of a variety of senile degenerative disease. So because of these situations, of course, the study regarding aging, especially in stem cell, getting increased. Okay, next slide. Now, we see from this paper published 2022 research on stem cell in aging-related disease. I just want to emphasize again, if cells getting older, there is a limited cell division, right? Even in the 9 hallmarks of aging, we have discussed it clearly. And then if the telomere length itself also getting decreased or even shortened, right? And then the cellular balance of the body is broken. We cannot avoid that. And number of somatic cell and stem cell is reduced. So it make a new insight for us when we try to collect the stem cell, especially adult stem cell. We can think that, the source must be, how to say, must be affected by the age of the donor, right? So that's why we need this kind of the physiology. And that figures just want to show that any kind of tissue affect due to the aging process and then the stem cell conditions itself. And we know that in the conventional therapy or traditional therapy, we give to inhibit the aging process by infusions, blood transfusions, drugs, and so on. However, recently, maybe within these 5 years or 10 years, they tried to go with the stem cell therapy. Okay, next slide. Okay, from the same paper, we also see that at least there are 3 stem cell sources, which are the stem cell from the embryonic, stem cell from the adult include the fetus or adult patients, and then the last one is the iPS, induced pluripotent stem cell. I think we all hear or even our colleagues in the online already know about it. So maybe I can skip it. Okay, next slide. Yeah, besides the stem cell itself, please don't forget that stem cell also can produce what we call as a secretome. And from this paper, Pharmaceutics 2021, I just want to show that the secretome itself, if we see more further, at least there are 2 parts, including the extracellular vesicles, or this is included the exosomes or microvesicles. And then the other one is the soluble factors. Maybe I believe Naila will explain it more further, right? So I just want to show there is a secretome that produced by the stem cell. Okay, next slide. Yeah, this is also want to show the safety comparisons between mesenchymal stem cell and secretome. Some of my students also doing this kind of research, but I cannot tell within this lecture because it's still under preparations of the manuscript, and then the others still doing, Dr. Andre, you know, right? Okay. So within these slides, I would like to say, I would like to share about the safety between the MSC and the secretome. I don't want to explain one by one because the time very limited. Okay, next slide. Yeah. Now we go to the research or study on the stem cell in aging-related disease. Again, I don't want to be entrapped specific for the skin aging. So that's why I choose this paper, because this paper showed that the stem cell can be used in the aging process for variant of the tissue, not only the skin, even though there is some related with the skin. regarding this review, at least they showed to us from 23 references with different studies, it consists of 7 different stem cell origin. I think last time from the previous slide, we already discussed about the embryonic stem cell, adult stem cell, right? And then it's more focused or more specific. For example, NSC, this is mean neuronal stem cells, and then later on we see there is adipose derived mesenchymal stem cell, hematopoietic derived mesenchymal stem cell, and so on. And then they showed to us from this review, they put what kind of disease they try to give a therapy with stem cell therapy. For example, POF, premature ovarian. How to say? What is P? I forgot. Premature ovarian failure or something like that lah. Next slide. There is some information. No need later. And then also for the Alzheimer disease, AD, Parkinson disease, stroke, SCI, and so on. And then, can you still hear me? Any trouble?
Yes.
Sorry.
Okay. Yeah.
Okay. Okay. Still okay. Okay. Great. Okay. And then if we see again, sorry, previous slide. I would like to show within this review, they only have 2 clinical trial, even that's still in clinical trial phase 1. So from the 23 study, from the some studies there, only 2 showed within this review, which already in the phase 1 situations. Okay, next slide. Okay, I think it's still same. Okay, next slide. Yeah, this is still from the same paper. Next slide. How about skin aging therapy? Of course, most of us here want to know within these conditions. For these conditions, from this paper, from Aging 2023, they tried to divide it mesenchymal stem cell preparations in clinical development for aging conditions, physically frailty, and then facial skin aging. So we tried to see the facial skin aging later on. Okay, next slide. From this paper, we found that, or we can see at least 7 studies which already in the clinical trial, because you see the identifier that some code there, it's got from the clinicaltrial.gov. And then we see at least on the first SPF, SPF mean stromal vascular fractions. It's come from the liposuctions, and then they split between the SPF and MSC. They use the SVF. Luckily, I can pronounce it well, because sometimes as a Sundanese people cannot SPF. Yeah. Okay. This
Sorry,
is
the screen is disappear now, Prof.
Oh, really? How about now? The screen disappeared. Sorry.
It is on my device.
Okay.
Yeah, it disappear and appear
Okay.
repeatedly.
So it's already okay. Okay. Now we can continue. From this paper, there is some conditions, especially for the facial skin conditions, and they did some clinical trials, and for number one, they said that there is an effective treatment using the SPF for skin quality from the patients after they treat with the SPF. Okay, next slide. I think that's all regarding how the study performs in the stem cell related with the aging process. Now we go to the ethical aspect because when we are a scientist, when we do the study or research, we cannot avoid with these situations or this issue, ethical aspect. When we are talking about the ethical aspect within stem cell study, of course, we have to think or we have to recognize the source of the stem cell itself. Whether we can imagine that when we are talking about the embryonic stem cell, we believe that, or in Indonesia and then in Malaysia as well, we cannot destroy the embryo, right? I don't know in Malaysia situations, but I believe when I studied there, it's also, I mean, the Sharia law not allowed us to destroy the embryo. And then, of course, there must be different ethical issue between the embryonic stem cell and then the adult stem cell, right? And then talking about the type of study, whether this is a preclinical study or this is a clinical study, of course, it affects the ethical issue there. And then last one, since this stem cell or using stem cell for therapy, this is still one of the emerging science. So the science that still, how to say it, that's still developed. So we can, we still don't have the complete data about the that things include the safety or even the efficacy, right? So this is still emerging science. So that's why we have to consider about ethical aspect. I believe also when we do a clinical job, right? Even in the clinical situations, more we should more hati-hati, careful, because I learned from my lecture, I mean from my senior college, the most or even the most fundamental things that we should remind as a doctors is please do no harm, right? So that's why we have to know what is it. So we don't want to our patients getting harmed due to our actions. Okay, next slide. Yeah, I already discussed previously from the previous slide. This is the source of the stem cell itself affect the ethical issue. Embryonic stem cell, adult stem cell, or even IPS, induced pluripotent stem cell. We thought that, okay, IPS we using the adult cell, cells that already well differentiate. However, when we try to reprogram the adult cell, can be the pluripotent cell. But still, when you take the tissue from the donor, if you didn't get a good informed consent, yeah, that's unethical. Because you know that when you take my skin and then you didn't talk to me that you want to produce the IPS, induced pluripotent stem cell, and then you want to sell it to other company. So maybe if I know you want to sell it later on or in the future, I don't want to give or donate my skin. So that's why there is still the ethical aspect there, and we should be careful or take a note about that. Okay, next slide. For 2021, I just tried to capturing it, and they talk about the potential hard and soft impact of stem cell study and stem cell based interventions. They divide it into two. Hard impact mean direct or physical, and measurable outcome or financial effect, but for the soft impact, this is indirect effect. So there are some notifications that we should be aware about the study using the stem cell, include the risk-benefit analysis, the reductions of animal in study, even if we know India now try to ban study to find out a new drugs using the animal since this July. And then the therapeutic value of stem cells based interventions and so on. And of course, for the soft impact as well about the revaluing animal research, because we learn about the 3R and 5F, right? Do you still remember 3R and 3R and 5F? But actually, if we just focusing on the 3R, it's just specific for that animals. Okay, if we already fulfill the 3R aspect, however, there is no social impact for that research. Is it still okay if we say it's already ethical after we sacrifice the mice, even though it's we already follow the 3R? No, right? At least that's what Bosams proposed for us in the ethical issue. I don't want to discuss later unless you ask or discuss within this lecture later. Okay, and then there are some issue regarding the ethical here. You can read by yourself because we don't have much time. It's almost more than, I believe it's already more than 20 minutes. Okay, next slide. Okay, this is the final slides from me because before I give it to Dr. Fauzi or Dr. Astrid, as a take-home messages as a students or as a clinicians later, I would like to emphasize that stem cell over potential regenerative solutions. However, there still needs study to confirm safety and efficacy, both preclinical or even the clinical study. And then the other things is because you want to become a doctor, and then there is still some uncovered theory regarding stem cells, especially for aging. We have responsibility for public awareness and education. So I would like to remind you, when you become a doctors or clinicians, don't forget to educate your patients. Okay. And then last, ethical considerations should be carefully examined and addressed when you do study using the stem cell for aging especially. Okay, I think that's all what I want to share to all of you here, both offline and also online. You see that figures. It's not too late to reassign you to bladder group. There is a nervous system. So we know that the stem cell can differentiate to other for any kind of tissue, right, or cell. Okay, thank you very much. Assalamualaikum warahmatullahi wabarakatuh.
Ya, Waalaikumsalam warahmatullahi wabarakatuh. Untuk Prof. Nur Atik, thank you very much for your lectures. Yeah, before you want to speak only for 20 minutes, but I think when you hold the mic, time is totally yours. Yeah.
Typically lecturer, right?
Yes. Actually, I also discussed it with Prof. Fauzi about that. Yeah, it runs in our genes as lecturers, I think, talking more than times allocated. Okay, thank you very much.
Yes. Sorry.
Okay, Dr. Fauzi, at first I want to take your permission if there is our student maybe want to ask in Bahasa. Is it okay, Prof?
Hey, yes, sure.
Yeah.
Because I just prepared the slide in English, so yeah. My brain already I have the so-called the common English communication. I mean lecture today, but it's okay in Bahasa also okay.
Yeah. Okay. Thank you. So all students, our beloved students, and also participants, if there is any questions, but we will talk about and discuss all the question in the last session. So please take notes for your question first, or maybe you can write down in the Zoom chat. Our admin actually our admin is also our student. Will record all the question and we'll discuss later. In bahasa, it's totally okay. Okay. Next session will be for Dr. Fauzi. Dr. Fauzi is how we call it, Doc, is the head of the CTERM, ya, Doc, ya, Center for Tissue Engineering and Regenerative Medicine.
Correct.
One very promising and best laboratory and research center in UKM, maybe focusing
Inshallah.
focusing in tissue engineering and regenerative medicine.
Yes.
Okay. Okay. Yeah. Hybrid lectures is it's even not easier. It's very challenging.
Yes, very challenging.
Okay. Not longer any time. So please, Dr. Fauzi, time is yours. You can share directly from your Zoom.
Okay. So I can share screen, right? Okay. Wait, yeah. Can everyone see my slide?
Okay. It's already. Okay, maybe then.
Oh my God. Okay, wait. Is it?
Yeah.
Can you see?
Okay.
Okay, everyone can see, yeah? Okay.
Okay.
Okay,
Please,
thanks. Yeah, thanks, Dr. Street. So thanks also, Prof. Atik, for the first lecture. Yeah, sometime when we got the mic, so sometime we lost our we got our control to handling the time for the lecture. So I'm not sure. I also have the blood for the Indonesian because my grandfather is like from Indonesia. So kabare, I hope everyone's okay. So today I will allow me to give a lecture in English, but it's still okay if you have any further queries. I mean in Bahasa or, but in not pure Indonesian. Some word I could like really understand, some word I can't. Okay, so today lecture it's not like a Prof Atik basically. It's like really it's like a good I mean a lecture style. I mean like information, but today I think me, myself, and Dr. Mandra will talk about the research finding from our side and our experience. As everyone knows, basically tissue engineering is at the moment they've come up with the so-called new team under regenerative medicine. We do have the tissue engineering itself as a one category, and then we have the cellular, cell therapy, and beside, and also we have the biomaterials as the what you call it, the new categories under regenerative medicine. So it's contribute to the like so-called aging or any like so-called medicine within this like big umbrella under regenerative medicine. So today I will like really share with you what we have in terms of like phase 1 and stage 2A, some of the output, clinical output, and what we do so-called improvement or advancement on top of our current so-called product. Okay. My lecture title will focus on the functional biomaterials technologies for the cutaneous tissue engineering. So at the moment, we try to focus on the best treatment that we can come out from our so-called research to fulfilling the perfect so-called a product for the skin application. So we are focusing on the inject skin instead of like aging skin. I mean either from the disease based aging related so-called skin, or it could be like from the elders, I mean so-called depending on the age of the person. So we try to improve the so-called integrity of the skin. But from our side, basically we depending on the what you call it, injured skin, and we do try to focus on the what you call it, to reduce the scarring, and then to increase more what you call it, reduce the what you call it, the stressful of like cosmetical aspect So we want that someone that already implanted with our product, they will be like easy to go back, I mean, to the work and maybe to the public and communicate with other people. Okay. So before I start further in our research finding, basically University Bahasa Malaysia or the National University of Malaysia is based in Bangi. This is our headquarters, located in Selangor State. And I think Prof. Atik study his PhD in I think University Malaya Kuala Lumpur. So basically University Bahasa Malaysia comprised of like three main branches. So we call as a headquarters in Bangi, as a main so-called faculties is located over here. And then we do have the near to the KLCC, Kuala Lumpur, what I call it, Twin Tower. And then we do have the biggest, health campus in Kuala Lumpur, containing of Faculty of Medicine, with our hospital, teaching hospital, they call Hospital Chancellor Tuanku Mohris. And we do have the specialist hospital, private wing, in 7th floor of our current teaching hospital. And I think last year, late of last year, we already started the children's specialist hospital. Okay. So meaning that we have the 4 different entities within the one campus, and in the near future we try to focus on the Technopolis development. So we will bring all the mid center Kuala Lumpur campus to this campus Kuala Lumpur. So it's like it's a middle of Kuala Lumpur and periphery of Kuala Lumpur. So our campus in the periphery of Kuala Lumpur. So we will try to gather everyone in the health campus. Okay. So this is the larger so-called scale of the picture. So we can see from this colorful building is like Children's Specialist Hospital. This is our building now that we stay to give you lecture in the 15th floor. And then we do have the Hospital Chancellor Tuanku Mukhris, and then we do have the 1 floor of our specialist hospital that's for the private wing. Okay. So this is brief, general information about our university. So today, our main so-called what I call it spirit to bring along the tissue engineering and advanced biomaterial for us to treat. The difficult so-called wound, for example, focusing on the diabetes wound ulcer at the moment, and we transfer our so-called research from the traumatic injury to the chronic wound to explore further. Is it a conventional so-called kind of a treatment or potential product could be have the similar time and output in terms of regenerative skin integrity. Okay. And at the moment, we try to venture out the 3D bioprinting, even though in overseas, this 3D bioprinting technology more than like 7 to 8 years already. But we just started, I think, last 2 years. And I will share a bit what the finding basically from our conventional so-called product in terms of like biomaterial in the spongy form. And against the 3D printed biomaterials product towards the preclinical model in the small animal like mice or rats. Okay, so as everyone knows, tissue engineering main therapies will be like have like 3 based approach. First will be like cell-based therapy, as Prof. Atik mentioned, and maybe I guess Dr. Mana also will touch a bit in terms of like cell-based and secreted cell product later on. So in our group, basically functional biomaterial technologies research group, so we focus on the scaffold-based therapy and also the cell-laden 3D construct through the extrusion method in the 3D bioprinting technology at the moment. So we still work with cells, but to test our material, but as an end product, we try to focus on the acellular therapy, so without cell therapy. But we still use whatever secreted of the product as the concoction, the composition within our design product. Okay, this is a natural-based biomatrix that we so-called explore in our group. So in CETM, Center for Tissue Engineering and Regenerative Medicine, we try to study a lot of natural-based product because it's the one strategy that how to pass through the local authority registration of medical device. We don't want to like interrupt more synthetic or maybe kind of like chemical approach inside our so-called end product, and we need to justify further. and cost to validate those information will be like higher, and some of the industry doesn't like to call it invest more of a lot of money basically for this kind of a medical device. So from our experience, if we have the continuous funding basically from the extraction of the product, either from natural or from synthetic, it will take around 5 years prior to the registration and complete at least phase 1 and 2 so-called clinical trial. But in our case, some is a delay due to the difficulties of our so-called funder that couldn't really provide continuously in the whole study from the scratch until the development of our medical device and mass production. So in our study, we are using cross-linking approach, including the chemical cross-link and also physical cross-link. We are not really look into the so-called photo cross-linking and enzymatically some of the, like for example, enzymatically based cross-linker will be like so-called high cost for us to venture, and we are validating our so-called own product using the lowest so-called cost and approach. We are using low chemical extraction method to extract our natural base biomaterial from the so-called various I call it green resources of biomaterial. For example, gelatin, collagen, elastin, and etc. For example, elastin we extract from the poultry skin, and then our collagen we extract from the tendon, sheep tendon leg, and then gelatin is from the raw bone from buffalo. Okay, so this is example of the conventional fabrication strategies that people have been studied a long time ago. These are a part of like technique for the under conventional, for example, freeze dry, electrospinning, injectable hydrogel, and solvent casting, and a lot of method I think since 30 years ago. So today I will share with you what we do have in our so-called center, that we are using basic so-called technique. Even though it's like this technique really so-called ancient approach, but regarding different formulation, we could like have a good or a really high quality product. So this is kind of like a spongy form that we could like provide produce from this freeze dry technique, and we could also develop in the bilayer the combination of sponge together with the so-called film, either from the cellulose base or maybe gelatin base. Okay, so in the advanced so-called design, so we further venture from injectable hydrogel, and then we could translate the injectable formulation using 3D bioprinter. This 3D bioprinter actually is a custom made our collaboration together with the industry. So it's a bit difficult at the moment, even before COVID, for us to buy really high-end machine. And every year the budgets are provided by ministry and also university will be cut off for like 10%, 20%. So we need to like so-called try to collaborate with the industry to come out with the proper so-called fund and continuing to generate postgraduate students. Okay, so from this so-called 3D bioprinting, we try to develop the organoids. It's still in early stage at the moment. So I will not discuss today because we need to do some verification for this output. And today I would like to talk about the combination of synergistic from the natural biomaterial based with the small portion of FDA approved product that is PBA in developing of the bio ink. Okay. So this currently, I think everyone could like really read through publication or maybe any articles regarding commercially available product. What we try to propose today, something that not focusing on the wound dressing at the moment. We try to focus on the what call it skin aquatense substitute. Basically, kind of like a temporary so-called design, without cells. We implant in the injured area. So that's our focusing, and then the migration of the cell will depending on the original of native tissue in the surrounding of the implanted area. So as a conventional scaffold, unable to reach a deep tissue for sure, for the sponge, for example, and for the deep and irregular shape, it's a bit difficult for our current so-called sponge product from the collagen to be reached in the small and narrow part. So we need to design certain the viable so-called approach how to reach deep wound and irregular, we could through maybe bioprinting, or we could use any nano scale product and also injectable hydrogel, meaning that from liquid they will fulfill all the space, and after a certain time they will be like polymerized. Okay. And then using 3D bioprinting or maybe 3D, injectable hydrogel could be advanced so-called approach for us to really to reach excellent defect margin adaptation, and then there will be like complete filling on the wound area. So we could like really what we call restructuring of like different type of wound shape. So it's easy for us through manually through injectable hydrogel. We need to play with the solid gel so-called approach, and then 3D bioprinting hydrogel through machine. We scan the defect and then we translate to the software, and then the machine will be print using our bio ink. So first so-called our gold product, this one since 2009 we work together, and at the moment I work together with Dr. Manira to focus on the clinical trial. And it started with the raw tendon material basically. So I still remember my final year project 2009, Prof. Dr. Rozima, they just show me this this is a tendon from the sheep. So you have 6 months to 9 months as a final year project for the undergraduate student. You should produce collagen. So it's a really challenging for me. I think from raw, I mean everyone knows about the tendon, right? So sometimes people just like cook this one kind of for the become like soup. So and then I need to extract this kind of like so-called viable tissue. I mean from the animal become so-called inert tissue that we need to functionalize to be used as high quality product as a medical device in like 6 to 9 months. So sometimes it's like a bit ridiculous, but we success to do it basically. And then we try to fabricate, we try to play around with the different temperature, and then we're using, as I mentioned to you just now, using freeze dry technique or lyophilization process. So at last we produce the really dry sponge and very good percentage of interconnected so-called porous structure. So we challenge our fabricated so-called collagen product from the sheep, and then we are successfully, microstructure is appeared by to fulfill the so-called basic fundamental for the skin so-called implanted product. But how you ensure that the cell from the native tissue from the patient itself could really migrate in grow their own family, right? So they will divide, and then they become matured, and then they will release all the matrices, and this kind of like temporary tissue substitute will be like slowly degraded. So this is our aim. We provide temporary home for the cells to be migrated in and develop their own family, and at last they can survive through the secretion of the so-called their own matrices, while this so-called implanted product will be like slowly degraded. In our so-called small animal study, we are required like maybe 13 or 14 days for this scaffold to be like fully degraded, and the wound closure is completed. The crusted everything will be like sloughed off. Okay, from that. So we got some idea that in small animal model we run many times with the different with the different so-called mice. So different mice, and then we got almost similar data. So to show that with or without cell. Okay, in this group we have without cell, these two group, and then we have the with cells, meaning that this collagen with cells, this one without cell. So actually it's no different. So there's various factors that affect, the output, but for the small wound maybe. So the cell is not really so-called useful at the moment because they could really migrate from the native tissue, from the normal tissue. So it's easy. But for to incorporation of the cell, it could be think about the larger wound, for example, like burn patient or maybe chemical burn, etc. So we need to have at least in the future, like for example, like cell spray, or maybe combination of the gel, hydrogel together with cell, and then we spray on top of this call patch. We call our product is call patch, already patented, and then we challenge our small animal finding to the big animal using larger wound area with the sheep model. So it shows, okay, from here you can see this one is like I think Dr. Maner's product basically focusing on the therapeutic. Still have a lot of crusted. OTC on the day 21 show the like really just final so-called cluster to be slow off. And this one are using PRP. So we can see that if you can see from here, the contraction of the so-called secreted product from the cell together with the so-called PRP is higher comparing with the OTC, meaning for the cold patch. This is a previous note in the research. So, and then the stability of the regenerated skin on this so-called sheep model will be like prominent on the cold patch comparing with these two. So, and then we published several papers regarding this so-called cold patch. I think it started from 2011. The study started from 2009. And then we continue until 2021. And recent paper, we are finalizing the safety study through accredited lab under medical device that all 6 so-called testing is successfully meet a requirement for us to fulfill the fully dossier documentation for the medical device. So this is the test I mentioned to you. This is our so-called prototype in packaging. We try to use the vacuum pack so-called design. And then this is a small so-called design of this cold patch. This is our aim previously to cater the full thickness skin wound, and then we implant with this cold patch. So at the moment we are trying to finishing the clinical trial phase 1/2A for the full thickness wound. We target maybe next April or May to finish this phase 1/2A clinical trial. So this is our so-called cold patch production team in GMP facilities. We work together with the, if you can see from here, the company that closely fund our cold patch production. Without company, I think it's a bit difficult for us to go further. As an academician, we just focus on the teaching and doing research, but we need to have a trusted so-called industry to bring our product go to another level. Okay, this is a patent filing for this cold patch. So this is one surgeon from our teaching hospital, Dr. Azimpo, that focusing on the reconstructive and also the reconstructive department. So at the moment, he's the one that handling our clinical trial. So this is our team. Dr. Manira is and then Dr. Iza together with our science officer, Mrs. Naziha. And this is the 2 buddies from companies that help us in terms of to running the clinical trial and also the production. Okay. So this is overall a roadmap towards commercialization for the cold patch. As I mentioned to you, TRL1, technology readiness level 1 started from 2009. After that, we gone through different type of fund, different ministry, and at the moment we reach in this TRL7 after 10 years, and we just have another like maybe 1 or 2 steps for us to register under local authority under medical device of Malaysia. After that, we could really start to market multi-centered clinical trial, and after that can so-called start to commercialize the cold patch. So this is like I think I just pick up randomly. This one more towards clinical research that we have from the presented patient. One of the case is like non-healing so-called wound on the foot for this patient. So this is referred patient from other hospital. And after consult with the Dr. Azim just now, our surgeon, so they agree to be tried. We are try with our so-called cold patch, and after 1.5 months post implantation, it show grateful, and the patient really so-called happy that the wound is closed nicely. Okay, post implantation. So if you could see from here, we could see like really 100% graft have been taken. Okay, after post implant. So this is. Any question? Sorry, I hear some sound. Or I can continue.
Okay. Okay. Is there any question until now? Maybe from student in the classroom? There is one question in chat, Dr. Fauzi, but maybe we can discuss later. Please continue maybe until you finish at first. Okay, thank you.
Because the full screen, I cannot see you all, so I just can see my slide.
Oh, okay. Yeah.
Yes. Okay, and then this, I mean, the selected so-called case. This one also consulted by the patient because the patient, I think, tried several times using the Integra. That also not really success, and several several trial in using SSD, split skin graft, but it's not fully healed. So after implantation of this cold patch, basically you can see from here, This is the sign. Signs of like the 100% fully graph uptake from the cold patch. This finding similar when our surgeon implant Integra. So basically, what I try to say is within 0.7 months, is depending on the case and the size of the wound. So it mimic the performance of our so-called already commercialized product from Integra. So it satisfies us as a researcher and also our surgeon. So that's the reason we go further at the moment for the clinical trial. And then I can go to the next slide. Don't worry. Okay. So that is our so-called pure collagen that we produce from the sheep tendon. Basically, we are not put any so-called extra or additional or advancement, any so-called compound, nanomaterial, antibacterial, or etc. But from our cold patch, basically, we try to design how to help the larger so-called diabetic ulcer or maybe bed sore or difficult wound together with the antibacterial what I call it compound. But I think a lot of study worldwide that focusing on the antibacterial, but they are focusing on in terms of release, even nanoparticle, nanosilver. In our case, we try immobilize this so-called antibacterial compound on top of our cold patch at the moment. So Amira is our current PhD student or candidate, just submit her thesis. At the moment, we are looking to the combination of engineering technology together with our so-called current expertise through cold patch. So we try to what I call it immobilize this active compound that containing of antibacterial properties. So we are using plasma polymerization approach. So with the volatile compound, in this case, we are using carbon. Carbon is like a active compound from peppermint, okay, from the natural based product. So if you can see from here, this is our current cold patch that I show you in the clinical trial and also in the research based so-called finding. So we try to immobilize using the plasma treatment, so meaning that they will create a permanent so-called layer on top of outer layer cold patch. So meaning that in this study, so when we implant, so this antibacterial on top of this biomaterial or cold patch that we developed before to against the so-called or killing or reduce the growth of the bacteria on the surface after implant. So this is our main purpose. Because, for example, the diabetic ulcer patient, I mean in Malaysia, in case in the scenario in Malaysia, so every 3 months the diabetic ulcer patient will come, and doctor just always doing the debridement, washing after clean everything, just do the normal dressing and you're going back. After certain time, there will repeated infection, so the patient will come again. This will be like hurdles even to for hospital to cover a lot of patients to come and then doing the same treatment. So that's the idea from our surgeon. Can you develop something that functionalize, I mean in terms of how to develop this regenerated difficult so-called wound, for example diabetic ulcer or maybe bed sore. Okay, so we try to reduce the risk of a nano safety issue that at the moment not really resolved even in Malaysia. Basically they're still in this in some part of the global area. So we try to do immobilize, so meaning that when we implant, you can see from here this like the orangey color will be like degraded slowly within the 14 days I mentioned to you just now through the mice model. But this top layer will be like integrated with the so-called crusted formation and after reepithelialization of this implanted area. So meaning that this so-called immobilized compound will be stay there and they will follow, then will slow off slowly following time. So this is our design, how to maintain the current properties that we achieve in the cold patch, but at the same time they bring the antibac compound. Okay. So this is something that advancement that we do at the moment through our conventional approach using freeze dry to provide the functionalized medical device. Okay, so this is some output from this developed material. So if you can see from here in this study, we try to use OTC as a cold patch, basically just collagen type 1 without any cross-linker. But in this study, we try to use genipin. Genipin is basically from the from the flowers. It's a cross-linker. And at the same time, they bring also the antioxidant. So they bring the dual function after we apply this kind of like cross-linker towards the coil patch. So however, for example, flower-based natural product, natural cross-linker will be like have colored. Even quercetin have yellow color, juniper have the dark blue color or purplish color when they meet any protein. So it will be like darker when we implant to the patient, but it's not like tattoo, okay? So they will be dissolved after they're fully degraded. So don't worry, because our mice also don't have any different color, if you can see from the previous output. So and then we do also the physical cross-linker using the hydrothermal cross-linker. This method we are doing together with our collaborator from Kyoto University, Prof. Elsie Kutabata. But however, the performance of like physical so-called approach, so on top of our coil patch, it doesn't work great. So that's the reason why we focus on these two, Genipin and also the OTC. PPK meaning that this like after cross-link we polymerize the active compound carbon on top of the fabricated scaffold, and we run after biodegradation, etc. It's not much different in terms of physical properties. You can see from a very nice interconnected structure, even using freeze dry. This is the way how this data basically is like depending on luck, you know. Sometimes after you cross section your fabricated scaffold, you can see from this structure only, but sometimes you can see from this angle, because we don't know through freeze dryer, we are not sure how the crystallinity happen inside the sponge, right? So this show that whatever you fabricate in the freeze dryer with the correct formulation, so you could reach, the interconnected pores. Every scaffold through freeze dryer could have pore, but interconnected pores is really important for us to ensure cell from left to right, from top to bottom can migrate in and interact each other. Okay, prior the slow degradation of this implanted so-called coil patch. In this case, we enhance with the carbon as antibag. So if you can see from here, it shows that our coil patch together with the carbon show the antibacterial output. So you can see from here, really, I hope it's really clear on the Zoom screen. So if you can see after we do some post PPK, meaning that we integrated with the carbon layer, and, after using plasma polymerization, it show the bacteria is like really dead. Many of bacteria is dead. So meaning that our plasma polymerization is successfully integrated the carbon on top of the sponge itself. Okay, the green color will be like live bacteria, but after we treat with this post, it show a lot of bacteria, even gram-negative, gram-positive, show reducing number of live bacteria. Okay, and as we need to do so-called validation that after you incorporate something on top of your pure collagen, is it they will change native properties? Okay, we don't want after we integrate something, the clinical output just not reaction, they will not there. So we don't want this happen. So we challenge our so-called fabricated product that we plasma polymerize and show that angiogenesis could be still support. So this is a good basically. So when we implant to the difficult wound like ulcer and etc., so they will encourage the formation of newly formed tissue very fast when the angiogenesis will be happen on that so-called dead valley area after implant. Okay. So this biocompatibility to show that HDF meaning that human dermal fibroblast. So we are not using cell line, we are extracting cell from the redundant skin patient, from the consented patient, after we got the ethical approval from our university to show that with the even the combination with PPK, there's a no, it's like not significant dead cell, okay? So as compared with the DHT, so even though we after we test using our TC also, because life cycle of cell is they will have life cycle, right? So the cell will be like grow, dead, etc. They will divide. So in this case, DHT we remove from our study and just we focus the other group, okay, to go further. So and then we test with the human epidermal keratinocyte because as everyone know, our skin containing of two layers. So the top layer will be like focus on epidermal, that the main cell should be human epidermal keratinocyte. If you can see from here, using the physical approach of cross-linker, the hydrothermal to show the high dead cell comparing with the natural based cross-linker, that's Genipin, and also integrated with the active compound of antibacterial carbon just now. So through SEM, you can see the cell really like our so-called fabricated scaffold that enhanced with the carbon just now. So we have no issue in terms of compatibility and safety of our current fabricated scaffold. And then we are challenging this so-called scaffold to show that even with the plasma polymerization, with the combination of the carbon itself, doesn't interrupt the migration of the cells inside the sponge form of cold patch. Okay, so if you can see from here, day 1 and day 7, it's a different group basically. So day 1, basically, we just sit cell on top of the scaffold, either what I call it keratinocyte or fibroblast. After day 7, so you can see the cell migrated downwards. Okay, this model just like to challenge your scaffold is interconnected oral structure. So meaning that there was support. So this one will be like simulate to simulate the real scenario in the application in the near future. So you implant this kind of a scaffold to ensure the cell from the native tissue will be migrate in. That's the concept behind this experimental design. Okay, so and then we run all the protein expression, show the with the genipin cross-linker together with the carbon itself, you can see reduce alpha spermaceti. So as everyone know, in the healing process, mainly for the skin itself, myofibroblasts will turn to defibroblasts later on. But myofibroblasts is really important portion for the wound to be contract, and there will be like reduced exposure of the wound, initial wound. However, in the certain case, for example, if it wound happen in the joint area, so we don't want the healed skin will be like what you call it, constrain the movement of the hand, maybe or the leg. So we want something product that could like really balance in terms of the existing alpha spermaceti 18. In this case, we are focusing on the lesser expression of the alpha spermaceti 18. You can see from here, cold patch crossing with the genipin alone is reduce the number of the expression of alpha spermaceti 18, and after we implant, after we so-called combine with the carbon, there will be like more reduction of this alpha spermaceti 18. So we can expect that from our cold patch itself in the shape model, and with this current design, it could be maybe lesser. Instead of 30% contraction, maybe it could be like reach only 20%. So this is our aim in the near future. Okay. So this is another so-called antibody to ensure the cell is really active and a good so-called have capability of our scaffold to support the cell growth later on. And then it's a vinculin basically for the keratinocyte cell, show also the good expression. They really support the survival of the cell on the scaffold. It's really important, but again, it's depend on the tissue. For example, like skin, I have mentioned to you 2 layers. You need to test mainly two main cells for 2 different layers at least. Okay. And then so we implant to the in vivo. If you can see from here, with the gene PPK, with the genipin crossing and also carbon plasma polymerization show the higher what I call it closure on the day 17. But again, this model cannot be compared with my so-called cold patch just now in the mice model, because this model is a chronic model, it's a diabetic wound. Okay, so it's extended to day 17 to be healed. Okay, so if you can see from here, OTC alone is a really lesser what I call it contract compared with the NPPPK. But again, for everyone information, mice model is a preclinical small model. So mice model is like contraction based wound healing. So meaning that whatever you put, there will be contract, no choice, because it's a loosened mice structure. But again, if you have extra money, you can go to up to the what I call it larger animal model, for example, like sheep model, it's like porcine model, and etc. to mimic really tight skin structure of human. Okay, to get the contraction, how many percent, the best, as I mentioned to you in our cold patch study. So this anatomical data basically that show our however microstructure analysis, you can see from here, even our OTC alone, this one with the genipin and crossing with carbon, basically you can see the very thin layer of epidermal show the higher faster remodeling phase comparing with the OTC still thicker, you know, because this one is mice model, it should be mimic normal skin. Okay, so this is our so-called guidance how to ensure which one. From growth you can see almost similar day for the healing, but microstructure to show you stability of the skin. So either they're faster a bit in terms of the modeling phase, or still in the first phase of remodeling phase. Okay, so you should have the normal skin. If you normal human skin, and then you need to compare. And then this one just like expression of the matrices of the so-called collagen expression using meson trichrome, and then we have the picrosilus rate to see the what kind of like matured collagen that available after you harvest on the day 7. Okay, this is really important. Okay, because through picrosilus rate, they have a different color. We have the green, yellow, and darker red color. So darker red color show the very high matured so-called skin. If you can see from here, this one is like really, I mean, almost similar. Even this one like pinkish color. This one is like really darker so-called color, because we cannot really compare. I mean, the color should be the same because this one is already survived how many months for the mice model, but this one is like just reached the 17 days newly formed tissue. Okay, so and then we do some like say expression to show that the bilayer is like nicely formed, and then you can see involucrine so-called stain show that tissue already formed. Okay, after implant to show the maturity of our so-called treatment. And then we do run DTM to show one structure of the epidermal. If you can see from here, this is a tight junction. Epithelial cell will grow together. They can't like really grow alone. They cannot survive. Keratinocyte always grow in colonization. So it should be have tight junction even in the tissue. So in the dermal epidermal junction, it should be have the what I call it river-like structure. This one to separate the epidermal layer structure with the keratin, call it composition, and down there will be like matrices from the dermal layer with the collagen striae. So this one you can see this formation of the collagen to show that yeah, the normal collagen is excreted from the in the newly formed tissue through the cell itself already done, already in progress. So to show that the remodeling phase still going on. And this one just like because we try to like what I call it challenge our so-called antibacterial so-called compound just now, and then we try to touch again on the mice after we open the wound dressing after day 7 and try to swab, and this is so-called the bacteria that we could see from that part basically. So this one like still basically in early stage, we need to do a verification to ensure that maybe after day 7 some of the compound basically already removed or sloughed off. So that's why it still have the growth of the bacteria. Okay, and then this is a so-called, because people ask us because most of the published papers show that they are using enzymatic approach how to look into the implanted product will be like how many days will be like fully degraded. So we challenge our so-called scaffold by subcutaneous pocket and look into the possibility, and it showed that yeah, within our interested time frame, the so-called implanted what we call it cold patch and advanced cold patch will be like fully degraded. Okay, through this in vivo model. And then this another study I want to show that now we are focusing on the 3D bioprinting. So I hope I still have time or exceeded. Okay, sorry. So this is so-called our first like attention to create our own natural based biomaterial. We are not using any so-called synthetic together with our current bioink. We want to see the capability of gelatin itself to grow to be printed. Okay, as a biomaterial ink without cell, if bioink with cell. So it's two different terms that you should know. So if like I'm focusing on the cellular biomaterial, I need to print biomaterials ink together maybe with the product from the terminal, for example, secreted product, or we have like so-called active compound from the natural base, like from the plant, from the flowers, and etc. Okay. So this our initial so-called physical properties hydrogel that we ensure through injectable hydrogel. We optimize first this kind of like so-called formulation. After that, we translate to the machine. Sometimes we need to do some adjustment. So any development of biomaterials ink or for the bio ink, you need to start from the injectable hydrogel. You need to challenge the formulation. Is it good? Is it can be like polymerized within the time frame when they print? Because we don't want the ruptured structure after you print maybe 10 layers or 20 layers. Okay. So after we challenge our so-called biomaterial to see any like porous structure have been formed to ensure the cell will be like migrated in. I mean almost similar characteristic. Any approach that they use, you should have the fundamental characterization that your formulation or technique should be rich, so meaning that the cell will be like migrate in, they can like grow, they can survive, no toxic effect. Okay, and then we run again with the cytotoxic study to ensure the bioprinting itself mechanically not killing the cells itself. Okay, so before that we try basically we try to like using fibroblasts, HDF, human dermal fibroblasts, to see, because fibroblasts is really robust. If fibroblasts cannot grow to any of your formulation, either bioink or any form of scaffold, do not don't think that epithelial cell that is keratinocyte could grow. Okay, because fibroblast is really robust. When you just like throw away, they can grow. Okay, but if this fibroblast cannot grow in your any formulation, don't expect epithelial cell that is keratinocyte or any epithelial cell can grow on your formulation. Okay, so and then we challenge our so-called 3D bioprinted material. So it's still spot of the formation using gelatin base. We are using halal gelatin base from the Nita gelatin that produced in India, even though they headquartered in Japan. We work closely with them to ensure this so-called gelatin could be used. For can cross religious basically using this kind of like product. So it is our next strategy, how to cater the all needs. Among religious, among countries, among different regions worldwide. Okay. So after that, we implant with the mice model. Again, we always start with the mice model because we need to start best among the best formulation prior to implant to the larger animal. Because as everyone knows, larger animal will be like really high cost in terms of their care after implant, and this is give an idea, okay, how good our formulation after implant. So it show that our bioink really meet the what call it requirement. This model also is not a normal model of mice, is a diabetic mice. So again, if you can see from previous my PhD student, this PhD student also made like fully requirement, I think within 70 days, fully closed, okay, for the wound. So we can expect for the human application later on, this could be like promising bioink to be used either in the printed through machine approach, or you can manually inject towards the defect area. Okay, this is our industrial partnership. Dr. Daniel Lloyd from Sato Health. This is the industry that fund our call patch basically for the mass production, GMP production, and also the clinical trial. So this is our other industrial partnership that closely work together with us. I think this company work on the peptide formation development. Then we try to do a research how to combine with the advanced biomaterial to deliver those so-called products. So this is our clinical partnership. Dr. Fatima is a surgeon in the KPJ, Ampang Putri. And this is Dr. Azim I mentioned to you in our teaching hospital. So this is our my beloved collaborators basically at the moment. I think Dr. Mena is always with me. Okay, and then we have the Prof. Antonella from Italy, and then Prof. Yasuhiko Tabata. And then we have the industry that developed the what you call it 3D bioprinting. I think Dr. Isa have one company in Indonesia. I forgot, is it Jakarta or different area? Okay, to cater the Indonesian need for the Dr. Izhar focusing on the metal printing at the moment. Okay, this is my group, members, Mrs. Naziha, and also our research officer, Mr. Shazana. So Dr. Yasuki Hiroka is our industrial partner. I think more than 5 years already supply the halal gelatin to us to further study the capability of the product. So before I end my session, I would like to invite, I think Dr. Ashrid know about this event basically. So I would like to invite again to all the what I call it audience to join our event next year, February, to 27 February for the winter school, one day, and then we continue next day with the conference, okay, in Commune Living and Wellness Kuala Lumpur. Okay, we have the eminent speakers that we invite from various countries. And I think that's about all. Thank you from my side. Okay, I pass back to Dr. Ashrid.
Yeah, okay. Thank you very much, Dr. Fauzi, for your elaborated and also detailed and also actually for myself makes me envy to do research in your laboratory maybe.
Okay, thank you. Please come anytime.
Yeah, yeah. We still have two more speakers,
Okay.
but I think two topics that already talked from Prof. Nuratik and also from you, it's already give many information to our students. So maybe I would like to at first highlight some point. So from Prof. Nuratik's lectures, yeah, we have to give our focus on genetics and also from the surroundings, epigenetic related to the aging, yeah, especially to our students here that their interest is about aging and aesthetic maybe. And please take care if you want to use products that come from stem cell maybe in the label. Yeah, Dr. Nuratik already shared about what you should give focus and attention when using or planning to use the stem cell. Yeah, and also it's not what is it? Yeah, from lectures, Dr. Fauzi, you can imagine how long the times and process for a product from stem cell or related tissue engineering come and to the patient safe and sound. So if you want to take or you want to, what is it, use from many from others from any medical products maybe, please remember this afternoon lectures that it don't come easily to you. It should come with very details, enormous research. So you as a GP or as a practitioner also must think about it, yeah, before you give to your patient. Okay. Actually, there is one question, Dr. Fauzi, but I think the question also related about secretomes lectures from Dr. Naila and also Dr. Manira. What is it? How is it, Prof. Nuratik? You want to discuss the question first or later? Okay.
Or directly to me. It's up to you.
Okay. Okay. So there is one question, Dr. Fauzi. So yeah, I conclude that the question is asking about how actually the preparation to maintain the stability of the resource from the stem cell maybe or from the bioscaffold until it can be used for the patient. Can you take the question clearly?
Okay, thank you. So yeah, that's the reason how I mean, whatever you did in the research so-called setup doesn't mean in the clean area will be like have the same output. I think maybe Dr. Mania also have the experience in terms of the cell production. It's a totally different so-called environment. But I will talk regarding the what I call it, not is a living cell. It's something that innate biomaterial. So for the living cell, for sure, you need to verify or validate your method basically to ensure the cell will be like so-called produced as A from the protocol. I mean, A to Z will be like product A. So, and the second person will do the same. They will be like need to produce is a still product A. That's for example for the living cell. And then another way, many things you need to justify and validate basically. So sometimes we just like so-called cell culture in the biosafety cabinet, but once translate to the JMP facility, the clean room, there's a lot of validation. It's kind of like the trunk of the tree, right? So the branches will be like all the documentation or validation in the clean room. So I mean to ensure yourself or whatever you produce inside the clean area will be like similar output whatever you produce in the research based product. But sometimes even though with our so-called material, I could say that one innate biomaterial, but we functionalize it after that. So the some step that we produce in the research setup is will be like need to be improved, will be like really need to be like so-called modified to mimic the clean area needed by our local authority to ensure the cleanliness and the stability of the scaffold is different. For example, like collagen basically should be stored. Collagen without crosslink should be stored inside the chilling temperature. So meaning that all the process should be maintained within 4 to 8 degrees Celsius to ensure the protein is not degraded. So meaning that whatever you extract from the raw material of tendon, 100%, maybe 100% protein should be maintained. Yeah, we couldn't really avoid maybe certain portion of the protein degradation because a certain maybe process. So at least maybe 95% above should be there, the protein, because if you couldn't really talk about reproducibility, this is really important even in research. That's why we should do something that the repeatability, for example, you produce cells from patient A and patient B, C, D, E, it should be the same output. The fibroblast, the keratinocyte should be have the same characterization. So meaning that you are successfully validate your protocol and all the condition. Same goes to the clean room, same thing. Okay, and also the material should be the same. Whatever that could affect the native so-called properties of your material, you should be critically think what is the backup plan. We don't want that whatever you've found in the research, when you translate to for the mass production and the in the clean area to make it in the sterile condition, they will come out with the same output. So whatever we found in that clinical so-called appearance just now I shared to you, the three patients, show that whatever we got from the small animal model, mice, and then big animal model, sheep, is the same output. So in the near future, we could really have the so-called standard of fundamental information. Okay, if you couldn't really reach, for example, 14 days fabrication of your material and for the biodegradation, so we can imagine that your the failure, the high risk of the failure for the implantation. So this is for the skin tissue. Later, if you change to the bone, you have the bone characterization for your scaffold. So different type of tissue have a different type of basic fundamental to ensure successfully from the research-based setup, in vitro safety study, a preclinical model prior to the what you call it, mass production and the clinical trial. So this one it should be tally. Okay, and we do have the certain parameters to validate. For example, how are you sure that when you change so-called one step, because to fulfill the need or requirement for the clean room, all the native property will be maintained. So we will do like, for example, EDX study, and then we do have the IR study, okay, to ensure all the basic functional group still there. Okay, so this is you could determine the criteria, but you need to think about the cost. If you put more clarification or more testing, you should put more money, okay, as a raw cost. So and then you can't like really sell your final product with the low cost. So we should think about the commercialization aspect. So the interaction between researcher, academia, and also industry is really important to make sure our product maybe within 5 years it's already reached all the what I call it commercialization setup of product. Okay, so this I mean briefly. So maybe later Dr. Manira and Dr. Nela also can really share what is their thought. Okay.
Okay, thank you, Dr. Fauzi. Maybe Prof. Nuratik, you have to come here to be on screen and have another opinion, maybe, please.
Okay, I think I can answer, chip in for discussions here. Sorry.
Please come to.
Okay, before that, I would like to say thanks for Dr. Fauzi for good presentations with your nice result. No, thank you. I agree with you, Dr. Fauzi, regarding the stability of the product. We know that it's a long journey to find out new drugs, especially for the biomaterials or even how to say it, biological compound.
Yes.
Include your study. And then after we find out the efficacy, sometimes when you try to apply to the patients, we still need to think about the the stability of your product, right? As you explained recently last time. I just want to emphasize here to all my students, it's not easy when we try to find out a new products here, and then even after we get the efficacy from new things, in this case is biomaterial things, we still need to think about the adjuvant or even vehicle. Maybe Dr. Manira will explain when she explain about the secretome or other derivatives of the mesenchymal stem cell. And then Dr. Astrid also try to pass on the questions regarding the adjuvant for the secretome, for example. Maybe we can think some vehicle as recently the liposome or nanoparticles develop well. So maybe we can think about it besides, for example, emulsions, creams, or gel-based and so on. But I thought that liposome and also nanoparticles should be or might be considered to become one of the vehicle. I think that's all. But I really want to visit your lab, Dr. Fauzi, to learn many things from you. Thank you.
Yes, please come. Inshallah.
Yeah.
Just let me know. Yeah. Just WhatsApp me.
Okay, yeah. Why we are so eager to maybe soon visit your laboratory? Hopefully, we have the
Okay.
funding for the travel. Because
Okay.
actually, in our institution or our study program, the idea of the research for wound healing is many of our students doing research about wound healing, but because of the lack of maybe more to the imaging facilities, maybe the
Yeah.
one that we less have it in here.
Oh, okay.
So the research is still very basic in
Okay.
exploration.
So I
But
think
yeah,
we can work together basically. So even though we are focusing on the therapeutic part, so maybe there was something from your side that could like really generalize, I mean, in terms of the scarring, because I really need to look into the how to make it this I mean the scar formation of the healing process will be like really nice, smooth, and focus on the cosmetics perspective.
okay.
So I think that's
Yeah,
the most important. I think post healing. Yeah.
okay. Yeah, right. Yeah,
Yeah.
maybe through this event, we will have another fruitful collaboration, not only lecture but also research collaboration. Maybe not only also between the lecturer or the staff, but also for the students. Hopefully, we can make it right, Dr. Fauzi. Yeah. Okay. Now we will continue to the two topics or two speakers. At first, I have to told you all that one of our speakers, Dr. Naila, cannot be here in this class because she has another agenda that has to be there. So we will play her record lecture. But if you have any question to Dr. Naila topics, you can post it in the chat. Also, if you have another question, feel free to post in the chat, or maybe you can, in Indonesia is Japri. You can share your question directly to my number. Okay. Okay, yeah, we will start the video from Dr. Naila. All the participant, please bear with us.
Seluruh peserta online lecture dengan tema Skin Rejuvenation through Stem Cell Therapy, Where Science Stands. Perkenalkan, nama saya Naila Majida Alfarafisa. Saya merupakan staf dosen dari Departemen Ilmu kepada seluruh peserta online lecture dengan tema Skin Rejuvenation through Stem Cell Therapy, Where Science Stands. Perkenalkan, nama saya Naila Majida Alfarafisa. Saya merupakan staf dosen dari Departemen Ilmu Kedokteran Dasar Fakultas Kedokteran Universitas Pajajaran. Dan pada kesempatan kali ini saya akan membawakan satu materi dengan judul Therapy Modalities Using Stem Cell and its Derivatives. Terima kasih sebelumnya kepada seluruh panitia karena telah memberikan saya kesempatan untuk mengisi sesi ini. Namun saya minta maaf karena tidak bisa mengisi secara langsung dikarenakan ada tugas lain yang harus saya datangi. Dan sebelum saya berbicara lebih jauh, mungkin saya akan membuat satu klaim dulu bahwa di sini saya bukan seorang expert. Jadi ini sifatnya hanya sharing. Saya yakin lebih banyak yang lebih paham daripada saya. Jadi di sini hanya topik-topik umum saja yang akan saya sampaikan. Berikut beberapa pengalaman saya terkait dengan topik tersebut. Ini merupakan outline dari presentasi saya hari ini. Jadi di awal saya akan menyampaikan outline dari stem cell terapi, mengenai apa itu stem cell, tipe-tipe stem cell, dan karakteristik dari stem cell. Baru kemudian saya masuk ke core dari materi tersebut, yaitu stem cell based therapy dan stem cell free therapy, disertai dengan pengalaman penelitian saya terkait dua topik tersebut. Mungkin di presentasi sebelumnya juga sudah banyak dibahas mengenai apa itu stem cell. Stem cell adalah sel yang belum terdiferensiasi atau terspesialisasi menjadi sel dewasa dengan fungsi tertentu. Ini bisa ditemukan di banyak lokasi di tubuh kita, di banyak jaringan di tubuh kita. Dan yang unik adalah dia memiliki kapasitas self-renewing yang memastikan populasinya itu tetap pada jumlah tertentu. Nah, kemampuannya inilah yang membuat stem cell sangat potensial untuk dijadikan modalitas dalam terapi yang terkait dengan perbaikan jaringan atau menggantikan fungsi jaringan yang rusak. Nah, ini tipe-tipe stem cell saya yakin juga sudah dibahas oleh presenter-presenter sebelumnya. Tipe stem cell biasanya dibagi berdasarkan potensinya atau berdasarkan sumber di mana dia ditemukan. Kalau berdasarkan potensinya, biasanya dia dibagi menjadi setidaknya 4 kategori. Ada totipotent stem cell, pluripotent stem cell, multipotent stem cell, dan unipotent stem cell. Di mana yang paling besar potensinya tentu saja totipotent stem cell. Sementara itu, kalau berdasarkan sumbernya, biasanya stem cell dibagi menjadi adult stem cell dan embryonic stem cell. Tapi belakangan kemudian muncul induced pluripotent stem cell atau iPSCs, di mana kita bisa mereprogram sel dewasa sehingga potensinya menjadi mirip seperti stem cell. Ini merupakan karakteristik dari stem cell yang saya rasa harus kita ulas sedikit karena karakteristik inilah yang menjadikan stem cell punya potensi yang sangat tinggi untuk dijadikan modalitas terapi sel. Karakteristik yang pertama adalah stem cell bersifat blank atau unspecialized, seperti yang sudah saya ungkapkan di beberapa slide sebelumnya. Jadi stem cell belum mempunyai fungsi tertentu, belum mempunyai bentuk tertentu, dan bisa kita direct untuk memiliki fungsi tertentu. Gitu. Selanjutnya, stem cell mampu berproliferasi dan memperbarui dirinya dalam periode waktu yang relatif panjang, lebih panjang dibandingkan dengan sel dewasa. Atau renewing capacity yang tadi sempat saya singgung. Selanjutnya, stem cell memiliki kemampuan untuk berkembang atau berdiferensiasi menjadi sel dewasa dengan fungsi dan sifat tertentu. Ada lagi karakteristik dari stem cell adalah quiescence, artinya dia terhindar dari kemungkinan aging akibat replicative senescence gitu. Ada lagi karakteristik dari stem cell adalah homing potential, yang mana stem cell ini ternyata mampu bermigrasi ke jaringan dari mana dia berasal. Jadi dimanapun kita menginjeksikan stem cell di tubuh pasien, dia akan mampu untuk bermigrasi ke jaringan yang di mana dia memang berasal gitu. Selanjutnya ada engraftment. Sebenarnya ini lebih kepada stem cell mampu untuk merecreate jaringan yang mengalami kerusakan, gitu, menggantikan fungsi dari jaringan tersebut. Selanjutnya, yang terakhir adalah sensitive to environmental cues. Stem cell sangat sensitif pada lingkungan tumbuhnya, pada sinyal apapun yang dikirimkan padanya. Sinyal itu bisa membuat stem cell bermigrasi ke tempat tertentu, misalnya kalau terjadi perlukaan, atau bisa juga membuat stem cell terdiferensiasi menjadi sel tertentu dengan fungsi tertentu, gitu. Selanjutnya adalah mungkin kita bisa langsung masuk ke stem cell terapi. Jadi pada dasarnya stem cell terapi ini karena merupakan topik yang sudah sangat lama berkembang ya, setidaknya dari tahun 1902 sudah ada terapi stem cell base, yaitu transplantasi, salah satu terapi stem cell yang paling jadul, yang paling awal berkembang dan terus berkembang sampai saat ini. Sehingga saya akan menggolongkan stem cell terapi ini menjadi dua kelompok besar, yaitu cell-based therapy dan cell-free therapy. Seperti namanya, cell-based therapy ini atau stem cell-based therapy ini adalah terapi yang menggunakan stem cell secara langsung untuk menginduksi perbaikan pada jaringan yang mengalami kerusakan lewat mekanisme banyak hal, bisa melalui stimulasi, bisa melalui modulasi, atau bisa melalui regulasi. Nah, karena menggunakan sel secara langsung, biasanya para ahli juga menggolongkan stem cell based therapy ini menjadi dua kelompok besar lagi, yaitu autologus dan allogeneic. Kalau autologus kita menggunakan sel dari tubuh pasien itu sendiri, kalau allogeneic kita menggunakan sel dari donor gitu. Nah, melalui pencarian literatur setidaknya terdapat 4 jenis terapi yang tergolong pada stem cell based therapy. Sebenarnya masih banyak yang lainnya, tapi biasanya kombinasi dari 4 jenis terapi ini gitu. Terapi yang pertama adalah cell therapy atau transplantation, seperti yang sudah saya singgung sebelumnya. Ini terapi yang paling awal berkembang di stem cell based therapy. Kemudian ada genetically modified cell therapy. Kemudian ada lagi multicellular therapy dan ada tissue engineering. Mungkin saya akan bahas satu persatu. Nah, untuk cell transplantation atau cell therapy pada dasarnya dilakukan dengan menginjeksikan stem cell yang telah diperbanyak secara in vitro ke tubuh pasien guna menginduksi perbaikan di tubuh pasien. Jadi setelah kita isolasi stem cell-nya, stem cell tersebut kemudian diperbanyak secara in vitro. Tadi stem cell-nya bisa dari pasien, bisa juga dari donor, baru kemudian direinjeksi kembali ke tubuh pasien. Nah, terapi selanjutnya adalah genetically modified cell therapy. Nah, kalau pada terapi ini, stem cell-nya tidak serta-merta langsung diinjeksikan setelah diperbanyak, tapi dia dimodifikasi dulu secara genetik. Harapannya, stem cell yang dihasilkan nanti punya sifat atau mampu mengekspresikan fungsi tertentu gitu. Mampu menunjukkan fenotip tertentu yang akan tentunya membantu terapi yang kita inginkan gitu. Di sini contohnya yang dilakukan oleh Kimbrell dan Lanza pada tahun 2020, genetically modified cell therapy ini stem cell-nya diisolasi, kemudian dia dimodifikasi secara genetik dalam lingkungan in vitro, sehingga si stem cell ini bisa mengandung anti-cancer agent. Jadi ketika diinjeksikan kembali ke tubuh pasien, stem cell tersebut sudah mengandung anti-cancer agent dan mampu bermigrasi ke tempat di mana tumor itu berasal. Jadi dengan menggunakan terapi ini diharapkan efek dari anti-cancer agent itu hanya akan terlokalisasi di tumornya saja gitu, nggak meluas ke yang lain. Terapi selanjutnya ada multicellular terapi. Contoh dari multicellular terapi ini yang paling banyak dilakukan adalah penggunaan SVF untuk terapi. SVF adalah stromal vascular fraction. SVF ini adalah kumpulan dari 2 atau lebih jenis sel yang tergabung dalam sebuah fraksi. Nah, sel-sel tersebut di dalam satu SVF ini bisa kita temukan misalnya ada stem cell, ada plasmasitoid, ada fibroblast, dan lain sebagainya. Nah, diharapkan sel-sel tersebut dapat bersinergis untuk menginduksi efek regeneratif di tubuh pasien. Di sini di penelitian yang dilakukan oleh Al-Karbush et al. Tahun 2022 dapat dilihat bahwa SVF ini mampu menunjukkan impact secara lokal maupun sistemik pada pasien neurodegenerative disease. Nah, yang selanjutnya adalah tissue engineering. Pada prinsipnya, tissue engineering ini menggabungkan antara banyak komponen. Yang pertama adalah stem cell, yang kedua adalah biomaterial scaffold, yang mana dia berfungsi sebagai tempat tumbuh sel, dan growth factor, yang mana dia berfungsi untuk mendukung lingkungan tumbuh sel, sehingga sel ini diharapkan dapat berdiferensiasi menjadi jaringan tertentu sebelum akhirnya ditransplantasikan ke tubuh pasien gitu. Nah, contohnya di sini yang dilakukan oleh Bianco dan Robbie pada tahun 2001, mereka membuat tissue engineering untuk skin dan untuk skeletal. Untuk skin misalnya, sel fibroblast dan epidermis diisolasi, kemudian ditumbuhkan pada biomaterial scaffold untuk membuat skin gitu, sebelum akhirnya ditransplantasikan ke pasien yang mengalami skin wounds. Atau di sini kita bisa pakai skeletal stem cell yang kemudian ditumbuhkan dalam matriks. Jadi di sini scaffoldnya adalah matriks, kemudian diperbanyak secara ex vivo, baru kemudian ditransplantasikan ke tubuh pasien. Saya pernah melakukan penelitian terkait dengan tissue engineering. Penelitiannya sudah lama sekali, waktu saya S2. Ini sebenarnya merupakan kolaborasi penelitian antara Teknik Material ITB dan waktu itu saya dari Sekolah Ilmu Teknologi Hayati, dari Prodi Biologi. Saat itu penelitiannya sangat superficial karena masih bersifat eksploratif dan banyak melakukan optimasi. Di penelitian ini setidaknya saya mengujikan 3 dari 4 parameter penting dalam sebuah tissue engineering, yaitu tipe selnya, kemudian ada juga bioactive factors-nya, dan juga ada scaffold materialnya. Untuk scaffold material, saya di sini menggunakan silk fibroin. Silk fibroinnya kemudian diproses dengan metode salt leaching. Nah, LAA dan PRP-nya juga harus saya optimasi untuk mencari konsentrasi yang paling ideal, karena saat itu ada banyak literatur yang menyebutkan bahwa LAA dan PRP ini baik untuk digunakan pada tissue engineering, terutama kalau memang tissue engineering tisu yang ingin kita bentuk adalah chondrogenic material. Di sini kami berfokus pada pembuatan kartilago artikular. Jadi latar belakangnya adalah kami mengetahui bahwa kartilago artikular ini sulit beregenerasi karena sifatnya avaskular, sehingga kami memiliki ide bagaimana kalau kita membuat sebuah tissue engineering secara in vitro, jadi nanti tisu ini diharapkan dapat menggantikan fungsi dari kartilago artikular pasien yang mengalami kerusakan gitu. Nah, hal pertama yang kami lakukan tentu saja seperti layaknya banyak penelitian yang menggunakan stem cell dalam risetnya adalah karakterisasi dari stem cell itu sendiri. Kami mengisolasi stem cell dari adipose, jadi ADSC itu adalah adipose derived stem cell. Kami ujikan untuk dikarakterisasi, dan hasil karakterisasinya menunjukkan bahwa memang sel yang kami isolasi dari adipose adalah mesenchymal stem cell. Yang selanjutnya kami optimasi adalah scaffoldnya. Ada dua hal yang harus kami optimasi di sini. Yang pertama adalah konsentrasi dari silk fibroinnya, yang kedua adalah ukuran porinya. Karena seperti yang sudah saya sebutkan sebelumnya, salt leaching method membentuk sebuah scaffold yang berpori, porous scaffold gitu. Nah, ini kami ujikan dengan metode yang sangat sederhana, yaitu dengan MTT assay, sehingga di sini hasilnya adalah self viability. Dari hasil optimasi ini, kami dapat menyimpulkan bahwa konsentrasi silk fibroin yang paling optimal adalah 12%. Sementara konsentrasi dari ukuran pori yang paling optimal adalah 500 mikro. Bisa dilihat bahwa 12% dan 500 mikro memiliki self viability yang paling tinggi dibandingkan dengan kombinasi lain. Selanjutnya kami mengujikan biokompatibilitas dari scaffold yang kami pilih, yaitu silk fibroin scaffold 12% dengan ukuran pori 500 mikro. Ini kami karakterisasi scaffoldnya dulu dengan menggunakan scanning electron microscope, dan kami dapat mengkonfirmasi bahwa memang ukuran pori dari scaffoldnya adalah 536 dan porinya ternyata saling bersambungan. Selanjutnya, ketika kami menumbuhkan stem cell di atas scaffold, kami bisa mendapatkan bahwa stem cell-nya relatif tumbuh dengan baik karena dia sampai mampu membuat juluran-juluran filopodia ya di sini, juluran-juluran sitoplasma. Yang mana berarti scaffold yang kami buat cukup memiliki biokompatibilitas sehingga dapat menunjang pertumbuhan dari stem cell itu sendiri. Selanjutnya kami perpanjang durasi pertumbuhannya, jadi bukan hanya 14 hari, kami perpanjang sampai 21 hari dan kami amati lagi apakah masih ada stem cell yang tumbuh di scaffold yang kami pilih, yang kami ciptakan. Kenapa kami memilih 21 hari? Karena waktu yang dibutuhkan untuk stem cell sehingga dapat terdiferensiasi menjadi chondrocyte itu minimal 21 hari. Dan ternyata ketika kami cek cell viability-nya di hari ke-21, stem cell mengalami pertumbuhan, jadi masih ada sel yang viable di hari ke-21, bahkan mengalami pertumbuhan. Dan ketika kami cek di SEM lagi, ternyata memang benar. Scaffold kami memiliki biokompatibilitas yang baik karena kami dapat menemukan populasi stem cell di sana. Selanjutnya yang kami optimasi adalah konsentrasi dari LAA dan PRP. Di sini lagi-lagi metodenya sangat sederhana, hanya menggunakan MTT. Kemudian kami lihat cell viability-nya, dan dari MTT assay ini kami dapatkan bahwa LAA dan PRP yang paling optimal adalah LAA pada konsentrasi 50 mikrogram per mililiter, sementara PRP adalah 10% volume to volume. Begitu. Nah, karena kami di sini berniat untuk membuat articular cartilage tadi, kami kemudian mengecek atau menganalisis konten dari glikosaminoglikan, salah satu konten yang biasanya disekresikan oleh sel apabila dia sudah terdiferensiasi menjadi chondrocyte. Ketika kami cek, ternyata di hari ke-20 stem cell yang ditumbuhkan pada biomaterial scaffold yang kami miliki dengan lingkungan tumbuh yang ditambahkan oleh LAA maupun PRP mampu mensekresikan glukosaminoglikan dari waktu ke waktu secara signifikan begitu. Jadi kami di sini ya secara tidak langsung dapat menyimpulkan bahwa memang LAA dan PRP mampu menciptakan lingkungan yang menunjang diferensiasi tersebut. Baik, mungkin saya akan beralih ke topik selanjutnya, yaitu cell-free therapy. Nah, berbeda dengan cell-based therapy yang menggunakan sel secara langsung, cell-free therapy justru memanfaatkan produk turunan dari sel. Ini produknya banyak sekali. Terapi ini sebenarnya berkembang atas dasar pemikiran bahwa cell-based therapy memiliki sejumlah resiko yang tidak bisa kita hindari gitu, seperti misalnya immunorejection atau bahkan kemungkinan untuk berkembang menjadi sel kanker. Selain itu, riset juga menemukan bahwa sel yang diinjeksikan itu sebetulnya hanya bertahan kurang lebih 3 hari di tubuh pasien sebelum akhirnya mati. Tapi efek regeneratifnya itu masih ada. Jadi jangan-jangan yang menimbulkan efek regeneratifnya itu bukan selnya per se gitu, tapi produk yang dihasilkan oleh selnya gitu. Nah, karena penelitian ini relatif lebih baru ya dibandingkan dengan cell-based therapy, maka penelitian mengenai cell-free therapy ini masih sangat terbatas dan belum terlalu mendalam. Saya di sini mencoba untuk mengelompokkannya berdasarkan modalitas yang dimanfaatkan untuk terapi. Ini ada beberapa kelompok, misalnya digunakan untuk bisa kita menggunakan condition media atau sekretom, bisa juga kita menggunakan growth factor atau extracellular vesicle atau non-coding RNA dan mitochondrial transfer. Nah, karena berdasarkan pertimbangan waktu dan karena juga memang literatur yang membahas mengenai cell-free therapy ini masih relatif sedikit, mungkin saya hanya akan membahas beberapa contoh dari cell-free therapy. Contoh yang pertama adalah condition media atau sekretom. Penggunaan sekretom atau condition media ini merupakan bentuk sel terapi yang paling sederhana dan paling umum dilakukan karena relatif mudah ya. Sekretom adalah media tumbuh dari stem cell yang di dalamnya terkandung banyak sekali biomolekul termasuk parakrin kah, extracellular vesicle, growth factor, non-coding RNA, dan biomolekul lainnya. Nah, sekretom ini kemudian dimanfaatkan untuk terapi karena mampu memberikan efek regeneratif. Contohnya di sini yang dilakukan oleh Ivanisova tahun 2023. Ivanisova mengisolasi sekretom dari atau condition media dari MSC yang ia analisis, kemudian di dalamnya terkandung banyak sekali KGF, BFGF, dan lain sebagainya. Dan ia injeksikan ke pasien yang mengalami kerusakan tulang rawan. Dan ternyata injeksi dari condition media ini mampu meningkatkan regenerasi kartilago, menurunkan pembentukan osteofit, dan lain sebagainya. Nah, ini jenis terapi yang kedua. Ini yang paling berkembang karena ternyata para ahli menemukan bahwa extracellular vesicle ini punya banyak sekali manfaat dan punya banyak sekali potensi. Extracellular vesicle adalah biomolekul yang digunakan sel untuk saling berkomunikasi dan mengandung banyak sekali komponen biologis seperti protein, growth factor, non-coding RNA, lipid, dan lain sebagainya. Nah, yang lebih advance biasanya penelitiannya akan memodifikasi dua hal, either selnya atau extracellular vesicle-nya secara langsung. Kalau selnya, dia di genetically modified supaya dia menghasilkan EV dengan konten tertentu. Sementara kalau EV-nya yang dimainkan, EV-nya yang dimodifikasi, ya EV-nya dibuat agar dapat dijadikan pembungkus untuk komponen-komponen tertentu saja gitu. Saya pernah melakukan penelitian terkait dengan EV ini, extracellular vesicle ini, sebagai cell-free therapy, setidaknya di 2 penelitian, tapi sayangnya keduanya juga belum selesai ditulis. Ini saya lakukan ketika saya menjalani postdoctoral studies di SITH ITB. Jadi ide ini muncul pertama dari Ibu Marcelina Irasoniatan, yang saat itu kondisinya sedang COVID. Kami memikirkan potensi dari sistem sel ini, cell-free therapy ini untuk dijadikan sebagai terapi stem cell, terapi COVID gitu. Nah, seperti yang kita ketahui bahwa exosome content itu, jadi kami di sini berfokus pada exosome content-nya. Exosome content itu terutama microRNA-nya itu sangat dipengaruhi oleh banyak faktor, terutama lingkungan tumbuh dari si stem cell itu sendiri. Nah, kami kemudian berpikir apakah dengan menginkubasi stem cell di lingkungan tumbuh yang pada lingkungan itu terdapat biocompound yang memang memiliki potensi sebagai antivirus akan menghasilkan extracellular vesicle dan microRNA yang punya potensi sebagai antivirus juga gitu. Idenya sebenarnya berkembang dari situ. Akhirnya kami mencoba memilih 2 bioactive compound yaitu kurkumin dan quinin dengan pertimbangan bahwa kurkumin dan quinin ini berasal dari tumbuhan indigen Indonesia yaitu kunyit dan kina dan memang memiliki potensi sebagai antiviral gitu. Nah, setelah kami melakukan cytotoxic analysis untuk mencari konsentrasi kurkumin dan quinin yang paling potensial, di mana pada konsentrasi tersebut stem cell cukup sehat untuk hidup dan menghasilkan extracellular vesicle. Akhirnya kami tambahkan si kurkumin dan quinin ini ke media tumbuh dari stem cell. Stem cellnya kami isolasi dari Wharton jelly dengan pertimbangan bahwa isolasinya lebih less invasif dan juga memang pada dasarnya si tali pusar ini kan bahan terbuang ya, jadi kami manfaatkan saja. Kami inkubasikan selama 48 jam, kemudian kami isolasi eksosomnya. Setelah kami isolasi eksosomnya, dan tentu saja kami karakterisasi untuk memastikan memang benar yang kami isolasi itu adalah eksosom, kami isolasi lagi microRNA-nya. Nah, si microRNA ini kemudian kami analisis dengan nanostring untuk kemudian kami lihat apakah ada potensi dari microRNA-nya sebagai antivirus gitu. Sama di sini yang pertama kami lakukan tentu saja karakterisasi dari mesenchymal stem cell dan hasil karakterisasi memvalidasi bahwa memang yang kami isolasi ini adalah mesenchymal stem cell. Selanjutnya kami mengkarakterisasi eksosom. Sebenarnya ada 3 hal yang kami karakterisasi. Yang pertama adalah ukurannya dengan transmission electron microscope. Jadi extracellular vesicle itu kan ada banyak sekali. Nah, kalau eksosom dia biasanya memiliki diameter 30 sampai 150 nanometer. Nah, di sini ketika kami ukur dengan menggunakan TEM ternyata memang benar yang kami isolasi itu adalah sekretom karena berada pada rentang 30 sampai 150. Selanjutnya yang kami analisis adalah ekspresi dari CD63. Nah, CD63 ini adalah marka dari eksosom begitu. Dan ketika kami analisis dengan menggunakan kit khusus, memang benar terkonfirmasi bahwa yang kami isolasi adalah eksosom. Yang menarik di sini adalah ternyata penambahan kurkumin dan quinin itu mampu memengaruhi ekspresi dari CD63. Di sini kami menggunakan 2 kontrol, yaitu kontrol medium saja dan kontrol DMSO. Jadi kurkumin dan quinin ini kan terlalu dalam DMSO. Kami merasa perlu untuk menggunakan kontrol yang menambahkan DMSO di dalamnya gitu. Konsentrasi DMSO-nya sama dengan konsentrasi DMSO yang kami gunakan untuk melarutkan kurkumin dan quinin. Yang ketiga sebenarnya, saya kembali dulu. Yang ketiga sebenarnya kami melakukan NTA atau nanotracking analysis yang selanjutnya kami manfaatkan untuk mengetahui sebenarnya dalam 5 mili sekretom itu ada berapa banyak eksosom gitu. Nah, perhitungan ini kami gunakan untuk analisis selanjutnya. Sayangnya untuk microRNA belum selesai teranalisis, jadi kami belum bisa menampilkan datanya. Nah, selanjutnya kami kemudian berpikir untuk melanjutkan penelitian ini karena sebenarnya penelitian ini sangat potensial. Tapi karena dana yang terbatas dan juga waktu yang terbatas, akhirnya kami mempersempit aims dari penelitian kami gitu. Jadi instead of mencari apakah benar memang si eksosom ini bisa memiliki antiviral activity, kami mencari tahu apakah si eksosom ini mampu menekan ekspresi dari ACE2, salah satu reseptor utama yang digunakan SARS-CoV-2 untuk bisa menginfeksi inang. Di sini objek yang kami gunakan adalah Kakotu sel dan Verosel karena kedua sel tersebut secara normal memang mengekspresikan ACE2 dan Kakotu sel ini mewakili atau merepresentasikan sel yang sudah tertransformasi seperti halnya kanker. Sementara Verosel ini dia ibaratnya sebagai sel normal gitu. Nah, ada 3 hal yang kami analisis di sini. Yang pertama adalah internalisasi eksosom, Yang kedua adalah ekspresi dari ACE2 dengan menggunakan immunocytochemistry. Dan yang ketiga adalah ekspresi dari ACE2 dengan menggunakan Western blot. Untuk internalisasi eksosom sebenarnya kami melakukannya secara berkala dari 1 jam, 2,5 jam, 5 jam, 12 jam, dan 24 jam. Tapi di sini saya hanya menampilkan data 24 jam. Jadi internalisasi dari eksosom sudah terlihat bahkan di jam 2,5 jam pertama sudah mulai terlihat. Dan itu terus terlihat sampai 24 jam. Ini merupakan hasil analisis internalisasi eksosom pada ferosel. Bisa kita lihat, eksosomnya bisa terinternalisasi dengan baik. Begitu juga pada kakotusel setelah 24 jam. Nah, ini adalah hasil dari analisis ekspresi ACE2 pada ferosel yang sudah ditreat dengan menggunakan eksosom. Eksosomnya diambil dari stem cell yang sudah diinkubasi baik dengan kurkumin maupun dengan quinin. Gitu. Di sini bisa kita lihat bahwa treatment dengan menggunakan eksosom bisa menurunkan, bisa menekan ekspresi dari ACE2 pada ferosel. Sementara jika dibandingkan dengan kontrol positif dan kontrol negatif, hal itu tidak terlalu signifikan. Begitu juga dengan kakotusel, ekspresi ACE2 bisa dengan signifikan berhasil ditekan. Nah, selanjutnya kami berpikir untuk menguji tidak hanya eksosom tapi juga sekretom. Sebenarnya di sini kami mau memastikan dua hal, apakah memang benar eksosom yang memegang peran penting dalam menekan ekspresi dari ACE2 dan apakah dapat kita gantikan si peran eksosom ini dengan menggunakan sekretom saja. Karena berhubung sekretom jauh lebih murah ya dibandingkan dengan eksosom gitu dalam pengaplikasiannya. Ternyata baik sekretom maupun eksosom mampu menekan ekspresi ACE2 pada ferosel dan pada kakotusel. Bisa dilihat di sini. Namun ketika kami bandingkan, ternyata eksosom jauh lebih signifikan dalam menekan ekspresi dari ACE2, baik pada ferosel maupun kakotusel dibandingkan dengan sekretom. Nah, ini beberapa konklusi yang mungkin bisa saya buat dari lecture yang barusan saya sampaikan. Baik stem cell based maupun stem cell free itu sama-sama memiliki potensi dan sebenarnya bisa berkembang, bisa lebih dikembangkan gitu di kemudian hari. Namun baik stem cell based maupun stem cell free harus kita akui masih memiliki banyak sekali kekurangan. Nah, karena mungkin kekurangan-kekurangan ini, saya lihat researcher atau riset-riset itu sekarang banyak berkembang dengan cara menggabungkan kedua terapi tersebut supaya bisa saling melengkapi gitu kekurangan dan kelebihannya. Begitu barangkali singkatnya konklusi dari saya. Terima kasih banyak. Mohon maaf sekali lagi karena saya tidak dapat memberikan lecture secara langsung. Kalau ada question atau ada inquiry bisa menghubungi saya lewat email. Akhir kata, semoga bermanfaat. Wassalamualaikum warahmatullahi wabarakatuh.
Oke. Ya. Setelah kita saksikan bersama tayangan dari rekaman paparan Dr. Naila yang banyak juga memaparkan tentang informasi-informasi dasar ya terkait stem cell, scaffold ya, stem cell terapi dan ragamnya bagi mahasiswa saya di sini ya. Untuk penjelasannya mungkin nanti bisa menyimak kembali dalam record yang akan disimpan di media-media prodi ya. Untuk peserta yang lain juga jika berkenan dapat menyimak nanti tayangannya di media-media prodi juga. Ya, terima kasih. Oke, Dr. Fauzi and Dr. Manira, thank you for joining us until this time, Dr. Manira here. I want to introduce Dr. Manira to all of you. So, Dr. Manira, full name is Dr. Manira binti Ma'aruf. She is university lecturer in UKM and Center for Tissue Engineering and Regenerative Medicine, Faculty of Medicine, UK. Yeah, her research is abundant with many of good publication. Dr. Manira will share about secretome and related function. Maybe Dr. Manira, yeah. Please, time is yours. Thank you, Doctor.
Dr. Manira, cannot
Okay,
hear you.
yeah. Yeah, Dr. Manira, please, you can start your presentation. Thank you. Yeah. Do you have trouble to share your presentation, Dr. Manira?
Yeah, I think I have a problem with my.
It's okay. Take your time.
Okay, can you hear me now?
Okay. Yeah, clear.
Okay, clear.
Clear
Okay,
sound.
Assalamualaikum.
Okay.
Good
Okay,
afternoon,
thank
everyone.
you.
Okay, let's start now. Okay, sorry for the technical issue. So I think since I'm the last speaker, so I will go fast as I can. So I'm going to share with you guys regarding the potential use of cell-secreted protein or secretomes in tissue engineering and regenerative medicines. So this is the outline. So basically, I will discuss about the effect of secretome on cellular behavior and the combination of secretome with biomaterials for the skin wound healing, and how the secretome affects on the skin rejuvenation, especially for the cosmetic products. So I think everyone already know the approach of tissue engineering and regenerative medicine as discussed previously by the previous speaker, Prof. Atik, Dr. Fauzi, and even Dr. Naila. So the most important things before we can use our engineered product into patients, we need to complete all this preclinical study in vitro and also in vivo here. Okay. So I wanted to share with you guys regarding these tissue engineering products in systems. So basically we have a skin substitute where we isolate the skin cells from, this is autologous skin cells, and we are using the plasma from the patient itself to produce this skin substitute, and we implant at the wound area. And then we have this bone substitute where we incorporate the induce bone marrow stem cells. Okay, I want to remove this one. Okay, induce a bone marrow stem cell into osteogenic, and we incorporate with TCPHA construct, and then we implant at the bone defect, and we're also using the same construct for our alveolar bone construct. This is the monkey model. And we have nerve conduit, we have cornea substitute, we're using the limbal stem cells or buccal mucosa stem cells in cooperation with plasma, and then we using the amniotic membrane as a carrier for the cornea substitute. And we also have a cartilage substitute where we also using a bone marrow stem cell where we induce into chondrogenic lineage, and we directly inject for OA treatment, or we can sit on top of the mold for ear formation, ear substitute. Okay, so by combination of cells and biomaterials, we already discussed earlier before, it's not just cells and scaffold, but also there is a secreted factors that involve in this tissue regeneration. So during our medium clinical applications, we already completed clinical trials 1/2A. So we found that when we culture our single and bilayer skin substitute, there's also secretion of cytokines, growth factor, and chemokines that are really, really important for the wound healing. So by using this idea, we already know that cell actually produce the protein for their specific function. So it's under certain cellular conditions in normal body. For example, the beta cells in pancreas, they synthesize and secrete insulin, and neurons secrete the neurotransmitter. So when we culture the cells in vitro, we know that the cells will secrete something into the culture medium. So when we collect all these culture mediums as a waste medium or spent medium, so it's contain a lot of secreted factors from the cells, and we know, and some of the researchers call it as secretome, condition media, exosome, or extracellular vesicle. So actually, what is the difference between all these terms used? So the overall, the whole culture medium of the cells is actually, we can call it as secretome or condition medium. But in the secretomes or condition medium, it actually consists of molecules that release from the cells. It's either soluble protein, free nucleic acid, or lipids, or extracellular vesicles that have been mentioned by Dr. Naila just now about the exosome, microvesicles, or apoptotic bodies. So these secretomes or condition medium is contains benefit since it's a cell-free product. So it can be used allogenically, and it also can eliminate the negative aspect associated with the use of the cells. So what is the cell source for secretome? And mostly the secretome have been collected from the mesenchymal stem cells. It's either from bone marrow stem cells or Wharton jelly stem cells or adipose. So Wharton jelly stem cells and adipose derived stem cells is the most common tissue source for collecting the secretome, or for even for use as a stem cell, because it easily can be taken out because it's redundant tissue compared to the bone marrow. And the rest of the tissues such as keratinocyte, fibroblasts, and even sometimes we use the iPSC, every type of cell actually can secrete protein, so we can collect the secretome. So the culture medium used for collecting the secretome is also different. It depends on the types of the cells. So it's usually we are using a serum-free medium. And sometimes some of the researchers also can use with the FBS because they want to enhance the secretion of the proteins. So different type of media also play important role what type of protein have been secreted. So the preparation of secretome also different. Some of it will incubate at 24 hours or just one day, up to 72 hours, the hypoxic condition, normal conditions, and how to prepare the condition media in terms of to concentrate the protein or not. So it all depends on the process itself. So most of the secretome, the protein that content in the secretome usually the growth factors, fibrinogen, collagen, and ECM factors that in this case is mostly involved in the wound healing process. So in our lab, we are focusing on dermofibroblasts, human dermofibroblasts. So we culture the fibroblast cells anticonfluence, and we collect the secretome. And here we can see there is 3 types of medium that we are using. We just label it as KM1, KM2, and FM. So in secretome, we can find out there is a lot of protein secretion compared to the normal medium, which is just a fresh medium without the cells. And through LCMS, also we can identify a lot of proteins in the secretome that involve in the wound healing. So I hope the video, you can see the video play here, right? Everyone still can hear me, right? Because I cannot see everyone here. Okay, so I just continue. So when we supplement the secretome, okay, you can hear me, okay, good. Okay, when we supplement...
We see your presentation. We see and hear your presentation, Dr. Manira. It's beautiful.
Thank you.
Cells.
Okay. Okay, thanks. Okay, so when we supplement the secretome, so we need to optimize what type, what the best concentration that we're going to supplement to the cells. So in here we are using a keratinocyte. So we at the different concentration from 100 to up to 1,600 microgram per ml. into the cells, and we can see that this secretome actually support the attachment and proliferation and migration of the cells. And here at bottom part here, you can see the migration of the cells. There is different types of migration pattern. We can see here the left two here is the individual migrations, while this another tools sample at the right here, you can see there is like a collective migration. This is because different types of mediums have been used for collection of this secretome. So different types of medium also have a different effect on the cells. So the best conditions to collect this secretome is depends on the types of the tissues, the cells I mentioned before. There's a lot of cells. All cells actually can secrete secretomes, and passage. So in my case, we are mostly using up to passage 3 to collect the secretome, because passage 3 is considered good enough for cell to proliferate, and we have enough number of cells to collect the secretome. But when we talk about upscaling the secretome production, we need to extend the passage maybe up to passage 5 or 6, so that we can have enough number of secretome, enough volume of secretome, because whatever protein have been secreted into this culture medium actually is very little, it's very diluted. We need to concentrate it to have pure protein, which is at certain concentration that give effect to the cells or whatever we want to test later on. And then different type of medium also have different effect. And then the incubation times, as mentioned before, day 1 up to day 3, different storage temperature, since the secretome contains protein. So we need to store it at chiller conditions, 4 degree up to -80 for the best, to preserve the protein. And then the collection cycle. So I will explain later. So in our study, we have tried different type of incubation times from day 1 up to the day 3, which here we can see that the protein have been collected. The protein concentration is higher at the day 3. So biologically, we just mentioned, of course, day 3 consider higher protein compared to day 1. But if we prolong the incubation, because we are using a serum-free medium, the cells start to detach. That's why day 3 is the cut point for our cells here, the fibroblast cell, because beyond that, the cells already detached, and it's not really good for the cell. So when we test the cells in terms of the migration, attachment, and proliferations, it's still maintained and have a good cellular behavior with supplementation of this day 3 secretome. And we also test up to 5 cycles, where we introduce the cells with a serum-free medium, and then we collect as a first cycle, and then the same cells in the same flask, we supplement back with the precondition it back with the serum medium. So once the cells stable back, and then we incubate another round with a serum-free medium for the second cycle. So we repeat this step up to cycle 5, and when we test it, the cells actually still maintain the shape, the elongated shape, up to 5th cycle. So the protein also increase by increase the collection cycle. So we can save the cells without expand more cells to collect the secretome. So we can just use the same cell to collect up to 5 cycles. But we need to test whether this the different cycle, the multiple cycle collection, the secretome still have effect or not. So when we test on the proliferation and migration of the cells, so here we test 2 types of secretome from 2 different cells, which is fibroblasts and also from water jelly. So even up to 5 cycles, so the cells can actively proliferate and also migrated. And this one is about the protein concentration, where we store our proteins, the secretome, in 4 different types conditions: room temp 4 degree, -20 and -80, up to 12 months. So it also shows that the secretome maintain the protein concentrations, even though there is slightly lower in terms of growth rate, but there is no significant difference. So from here we can see that our secretome can maintain up to -80, but it's a raw secretome. We also test our secretome on the keratinocyte irrespective of age group. So we have 3 groups of keratinocyte: 18 to 35 years, 36 to 54 years, and more than 55 years old. So when we supplement our secretome there are 3 types of secretome here, and actually 2 types, and this one is the control group. So when we supplement our secretome into this different age group of keratinocyte, we can see slightly decreasing in terms of cell attachment, but there is no changes in terms of the growth profile. So regardless of age group, when we supplement the cells, it still maintain the growth rate. But for the wound healing, the more than 55 years old keratinocyte has lower healing rate, slightly lower compared to the cells which is less than 54 years old. But from here, we can see that even though it's a less healing rate, it still indicate that the potential of using this secretome for the wound healing in the aged skin. So the secretome actually can be used as either direct injections or combination with the biomaterials, or you can just purify the secretome into more defined, such as extracellular vesicle or exosome. So in my study, we are combine our secretome with biomaterials, collagen hydrogel, which is ovine collagen type 1 that already produced by our lab, Dr. Fauzi's team. So we combine this secretome and to form this soft semi-solid structure of collagen hydrogel. And under the FTIR, it shows a similar peak patterns with all the functional group OH and MITE 1 to 3, and all the characteristics actually maintain same as the native collagen. And it has syndically delivered essential biomolecules for future use, include skin therapeutic application. So we also did a test on the immunogenicity response in vivo and also in vitro. So in vitro PBMC proliferation assay. So from here we can see that our secretome does not have any effect on the proliferation of the PBMC, as well as the GPMT testing. Here we can see there is no sensitization effect of secretome on also the collagen on the guinea pig skin. And when we harvest the skin here and stain with the H&E staining, we can see there is a very nice thin epidermis layer here compared to the control group, positive control group that has crusted area here. So from this immunogenicity response, we can see that this secretome and also the collagen itself has no immunogenicity and safe to be used for clinical application. And we also have conduct in vivo skin wound healing, the small animal in mice and also big animals in sheep. So small animal, we create 1 diameter full thickness wound at the dorsal of the mice, and then we implant with different types of our secretome combined with different concentration of secretome with collagen hydrogel, and within day 14 and day 17 it's already closed the wound, and it shows that this secretome actually helps in the healing process. And in the sheep, for the big wound here is around 20 cm square. So I think this one already mentioned by Dr. Fauzi. So even though there is crusted area here, but still the secretum helps in the healing process. So the construct is actually degradable and release the protein to the wound area. And the animal models, the full thickness wound in animal models, is the healing process is really good without sign of rejection. And the histological analysis also confirm the structure integrity and maturation of this generated skin. So from here, we can see that our secretum fortified with collagen hydrogel could be a potential of the Shea product to be applied for immediate treatment of skin loss. So with the potential of secretum, we also explore the use of the secretum for skin rejuvenation and anti-aging. So we are still in the early phase where we use the formulate the secretum with a base cream for serum, toner, lotion, and gel mask. And with this certain testing to make sure that the stability and the physical testing for this product. So even our secretum also we already patented under dermal fibroblast sera. So this is the formulations. So we actually have collaboration with our pharmacy faculty to develop this formulation for skin product, the toner, serum, lotion, and mask. And there is also one of the aesthetic consultant that help us to develop this base cream. And we just choose the best concentration of secretum to incorporate with this base formulation. We also challenge these products with a centrifugal testing, the standard testing for separation, and there is only a slightly separation of this. I think this is the oil one, but still within the acceptable range. And when we test the physical stability under freeze-thaw cycle and expose this product to the high temperature up to 45 degrees Celsius and check for the physical testing, the appearance, draw, color, and pH and viscosity. So it's all within the desirable conditions. So we plan to send our products under heavy metal and sterility testing, or source under this testing, the BP 2013, which is standard for the cosmetic product. So, but it's yet to be sent. So I hope to be sent it by this month. And by our in-house testing, we found that there's all 4 products actually there's no contamination is considered sterile since we are already adding preservative to the products. So we're going to start soon our clinical trial for these 4 products with the title of Evaluate the Safety and Efficacy of Skincare Product using the bioactive compound secreted by dermal fibroblasts in the reduction of skin of facial aging, which is a non-randomized control study. So hopefully we can going to start. We actually plan to recruit the participant by this month. So hopefully by next month we can start our clinical trial for this product. This is the inclusion and exclusion criteria and the assessment we're going to use for this study in terms of the pore size, wrinkle, erythema, hydration, transdermals, water loss, elasticity, and melanin index. So we have dermatologists and also aesthetic clinic that collaborate with us to do all this skin assessment. So after application with all these 4 types of product, we're going to test this one. So they will do all the assessments. So we just do the analysis. So in our center, we also have one group that focus on the extracellular vesicles under Dr. Lau Jazens. So he focused on to extract the EV from the MSC, usually from water jelly stem cells. And he focusing on for the whole type of this regeneration and the osteoarthritis, atopic dermatitis, frailty, periodontitis, wound healing, metabolic syndrome, and for also cosmetic, for skin rejuvenation and skin whitening. immunotherapy, for NK, EVs, and also as for the drug carrier. So this is the ongoing studies regarding the EV. So I'm not going to tell details. So for as a conclusion, the secretome components is a bit of favorable outcome for tissue engineering and regenerations. So it has very benefits for skin rejuvenation, especially for the application of skincare, cosmetic, and medical treatment, since it can reduce the risk of immune rejection and also safe to be used. And the EV or from the secretome or the exosome actually can be easily extracted and quantified, and it's more stable for long-term storage compared to cell-based approach. However, there is challenges when we deal with the cells or the secreted protein because we need to standardize each batch of secretome. So what we're going to do, our plan is to just pull a few batch of sample as a master bank. So whenever we want to produce a secretome, we just revive the same batch. Okay, and then we also have the regulatory hurdles because according to the Malaysia Regulatory National Pharmaceutical Regulatory Agency (MPRA), this secretome is considered biologics because it's contained the active substance that derived from the living organism. Therefore, we need to produce all the secretome inside the GMP facility, and we need to declare all the dossier is like a drug treatment. So it's more complicated compared to cosmetic. However, the secretome or even the stem cell, there's a lot of potential to be used for the skin rejuvenation and also for treatment strategy. I think that's all from me. Thank you, everyone.
Okay. Okay, thank you very much, Dr. Manira, for your wow. I kind of lost word to comment your presentation.
Okay, thank you.
I chat with Dr. Naila there. Dr. Naila already
Oh,
can
Dr.
join with
Naila
us
already here. Yeah.
in
Hi.
Zoom. Yeah, yeah. Why? Because we are losing words. Since we are now doing research using secretome with our students here, one of our students here, and yeah, thank you for your presentation. We feel that we are on the right track, and hopefully it will doable to finish our research here.
Right.
So thank you very
Yeah.
much.
Okay.
Yeah, there is two questions here. One of the question from our student, and the others is from the other participant. So from our students, I will read the question apa adanya ya, Dr. Manira, dalam bahasa tidak apa ya.
Boleh.
Ya, mungkin ini juga nanti mohon dikomentari jawabannya oleh Bu Naila ya. Untuk terapi stem cell based terapi yang metode autologus dengan sel dari tubuh sendiri, apakah lifestyle, genetik, faktor internal, dan lain-lain dari tubuh pasien tersebut mempengaruhi stem cell yang terbentuk? Mungkin satu pertanyaan dulu bisa dijawab oleh siapa dulu ya? Mungkin dari Bu Naila dulu, Pak Dr. Manira dulu. Mungkin oleh dokter Dr. Naila dulu ya.
Dr. Naila.
Dr. Naila dulu ya, sesuai urutan persentan tadi.
Oke.
Terima kasih.
Terima kasih. Tadi sebenarnya dari presentasi yang disampaikan oleh Dr. Manira juga kita dapat sedikit membuat konklusi bahwa stem cell sangat dipengaruhi oleh lingkungan hidupnya. Jadi kalau lingkungan hidup tempat dia tumbuh yang mana adalah tubuh pasien itu sendiri tidak baik, ya tentunya stem cell yang dihasilkan juga akan kurang baik gitu dibandingkan dengan pasien yang memiliki lifestyle yang lebih sehat. Begitu mungkin barangkali hemat dari saya. Silakan Dr. Manira.
Ya, saya setuju sebab kita ada one case di mana patient yang kita terima diabetic patient and then dah tua juga, so dia ada mobility problem. So bila genetic and the lifestyle for the patient itu because of there is a community because there is what dia ada penyakit yang ulcer, everything. So mempengaruhi sel yang kita akan biarkan. Bagi pesakit yang muda, young age patient, when we harvest this sample, the cells actually memang akan grow very nicely compared to yang older patient yang ada penyakit. Sometimes even when we test our MyDerm previously, there's one case, even though that patient very young, around 14 years old, tapi dia mengalami ada infection, body infection, so they're on the antibiotics. So we're going to use dia punya blood serum to culture the cells because it's fully autologous, right? So there's effect of because of the condition itself, the patient itself, and that patient also the malnutrition. So the cells cannot grow. So we need to harvest as allergenic. So we take the blood from parents to culture the cells, and then we need to harvest again. So different part of the body also, when we harvest, also have effect on the growth of the cells. Okay, for example, dekat kita punya abdomen, so the skin and abdomen already expand. Okay, yang kita kegemukan sikit, gendut, so already expand. That's why dia punya fibroblast cells tu akan jadi a bit bigger. Okay, the formation rate akan lebih rendah compared to the skin yang kita harvest daripada eyelid or facelift. Okay, that one can be grow nicely and the formation rate is very good compared to the other part of the body. Okay, that's my comment. Thank you.
Okay, thank you very much, Dr. Manira and Dr. Naila. Next question is, actually this is also already answered by Dr. Fauzi before. I will read again. Maybe the one who asked this question also want to hear from your opinion, Dr. Manira and also Dr. Naila. The question is, when you make a preparation with stem cell or the secretom, for example, anti-aging cream, this question actually was asked before Dr. Manira presentation. I think the person can can predict your presentation, Dr. Manira. For example, anti-aging cream, how we can make sure the preparation will be stable, since as biological preparation both are very sensitive to the temperature. Maybe
Okay,
Dr. Manira first and Dr. Naila.
Yeah. Okay, so for our clinical trial with this product, actually we are not sure the punya stability of the secretome. That's why when we prepare the secretome with the base formulation, and when we going to pass to our participants, it's in chiller condition. Because we are in the process, like the Prof. Atik mentioned just now about the liposomes or nanoparticles. So we are one of the students actually already in the process to encapsulate the secretome with this liposome or nanolipid carrier so that it's more stable to be used. So in our clinical trial that we're going to start soon now, we just use the raw secretome without any encapsulation. So to maintain this protein in the formulation, so we just keep the product in the 4 degrees Celsius. So even the participant also need to keep the skincare product in the 4 degrees Celsius before being used.
Okay, so the product you showed us, the anti-aging cream come from the secretomes have to be stored in 4 degrees Celsius, yeah, Dr. Manira?
Yes, at this moment at 4 degrees Celsius. After we found out another formulation with the encapsulation, then maybe we can just predefine it again.
Okay. How about Dr. Naila? You have opinion maybe?
Well, I don't have any experience related with product from stem cell or stem cell derivatives, but maybe from my current study, I can conclude that when I use the fresh ingredient like secretome or extracellular vesicle, I can get more valid result compared to stored one. So I always encourage my student to use the fresh one, not store one. That's all from me.
Okay, thank you, Dr. Naila. Maybe one question for from me, Dr. Manira or maybe Dr. Fauzi nanti juga bisa memberi komen. Is it okay? Yeah.
Dr. Fauzi on phone.
Yeah. Yeah, I represent maybe a question from our study program, yeah, and our team regarding the research of secretum and its resources. How about your experience regarding to maintain the homogeneous condition of the resource, the sample resource? Yeah. Maybe you take from the wharton jelly from the patient, maybe, or you take the skin sample maybe from this the person. How you collect the data? How you make sure that all the sample come from as homogeneous as possible? Because we kind of have these difficulties. Randomly we wait for the sample to sample, something like that. How your experience? Maybe we can learn from you. Thank you.
Yeah, there is of course there is samples to sample variation. Even for the trial, we are using human skin fibroblasts. So at the same time, I'm also collecting secretum from wharton jelly. So we are not combining these two different sources just for the fibroblast itself, but from different samples. So for example, we have to pull 6 samples of skin as a master bank. So we cryo the cells from 6 samples of skin, and then we're going to, whenever we revive, kita pullkan all these 6 skin fibroblasts for collection of their secretum. So far I'm not, in terms of fibroblasts and wharton jelly, actually both of them have a good result for proliferation and migration, but still it's we are not tested yet in clinical. So it's just in vitro and in vivo study. So we need to further done the clinical to see the effect, whether it really helps in the real situation in human or not.
Okay, yeah. Yeah, I think we are facing the same challenge. Yeah, I don't want to say it problem. I want to say challenge. We facing
challenge.
the
Yes.
same challenge. Yes, the same challenge. How to make all the samples? Yeah, because we have to collect as much as possible, right? If we want to make it into the market, right? But how to make it
Yes.
as homogeneous as possible? Yeah.
So we
really
just
hope.
pull yeah.
Okay, best wishes for your clinical trial, because if it is success, yeah, it will be fruitful also for our side to more research collaboration with you.
Amin. Yeah. Thank you.
Yeah, I think we're approaching to our end of session. Dr. Fauzi, maybe you have any comment or opinion? Because sorry, Prof. Nuratik has another agenda.
Okay.
He already asked permission from me when Dr. Manira gave presentation. Please,
Yes, I think
Doctor.
should be okay. I think my feedback would be like we could look into the different approach in terms of two sides. I think from Umpat, especially for the anti-aging aesthetic medicine. So like I mentioned to you just now, it's like we not talk about the how to heal the injury. I mean, for our expertise, our background, but we try to like focus on the cosmeceutical perspective. So in the same time, there will be like reduce scarring, remove the keloid, and then the confidence level of the patient itself after heal, they will be like much higher. So and then we could have really in term socioeconomy for the patient and back to work again with the higher confidence levels, you know, but instead of like what you call it, another word is like cacat, you know, so it's not sampurna. So we need to remove this kind of like so-called it's not problem, it's like you said, it's like challenge. So how we need to make it I mean the best so-called strategy. So that's the reason why in our group we are not really explore many type of tissue, but we just focus look into the which approaches that really perfect. I mean nearest to the like I mean the native structure of our tissue at the moment is skin. Before we go further in terms of like what you call it another tissue, for example like cornea, bone, cartilage, and etc. So yeah, at the moment I could say your expertise focusing in the what we call it like I mentioned to you, I'm really look into the cosmeceutical and beautification. I mean after implant, after the post healing. So maybe we could look into the combination in terms of that. So either we delivered two components in the same time, one time implantation, or we could look into the dual so-called approach, the synergistic effect pre and post. Sorry, post implant for the first step approach, and then second one will be like focus on the cosmetic perspective approach. So to make it more perfect. But as you know, patient don't want to have a second intervention of surgery. So we need to look into the how to deliver this so-called kind of products. That one of the approach would be like the drug release strategy and nanoparticles. So maybe we could look further discuss later on, Dr. Astrid. So I guess yeah, again I
Yeah.
really invite your team to come to Malaysia next February. It's like compulsory, yeah. Okay, and maybe you could take one symposium, and we need to finalize so-called the symposium as soon as possible. So it's easy for us to strategize in terms of placement of your participants from your side in the venue hotel. So I think we already try to help to get more discount for our participants and delegates. Please look into the information, and any further so-called queries you could ask me and or Dr. Manira. Okay. So I think that's all from me, Dr. Astrid. Pass back to you.
Okay, thank you very much, Dr. Fauzi, for your closing remarks. Maybe, yeah, there is a lot of things or matters to be catch up, especially from our side. Yeah, for beloved students. Yeah, maybe you already know about stem cell, but there is another terminology, a lot of terminology regarding the stem cell and then the cell-based therapy, tissue engineering, etc. Yeah, don't be lazy to read again the the journal and etc. You can watch this online lecture again in our media. Yeah, the articles that give information basically about what is it, stem cells, other things in tissue engineering, etc. already shared to you.
Yeah.
So you can read it again. Dr. Naila, there's any comment from you before we close the
No, I think
session?
it's enough.
Okay. Thank you very much for all the speakers. For all the participants, if you able to open your video, please open your video because we want to take some documentation, some minutes for documentation. Yeah, from our side, there is already one student submit abstract, Dr. Fauzi, to your system, yes, to your event in February. Hopefully,
is it? Okay, good.
okay.
So
Hopefully we can, hopefully we
yeah.
can manage to get the travel grant to come
Yes,
to
I
your
hope so. I hope so. Yeah, please.
laboratory.
So later
Yeah,
inform me.
yeah.
So we will provide you a special link for the delegate for the hotel venue. So yeah, to get the specific discount. Okay.
Okay. Yeah, thank you. Yeah, we will communicate with you again.
Okay.
Okay, thank you very much. One more, Dr. Fauzi, Dr. Manira, thank you very much for your patience. Yeah, this is another learning process in our site, hybrid session, and then all the material, all topics regarding skin rejuvenation through stem cell therapy. Yeah, we hope that we can actually finish our research and go to the market about our product. I mean, Yeah, thank you again, Dr. Fauzi, Dr. Manila, Dr. Naila, and all the participants. Hope we all of us always in healthy
Yeah.
condition, and our goals someday at some point will be finished. Thank you
Yeah.
very much. Maybe I will close this event. Alhamdulillah. Wassalamualaikum warahmatullahi wabarakatuh. Selamat sore
Waalaikumsalam
semuanya.
warahmatullahi
Stay healthy.
Take care.
Thank
Bye-bye.
you.
Thank you.